Course Orientation. Community Health, Doctoral. A comprehensive overview of your doctoral journey. Triune Biblical University Global Extension, USA. www.buglobalextensionusa.com. Distinguished members of the incoming doctoral cohort. It is my privilege to welcome you to Triune Biblical University Global Extension USA, TBUGE USA, and, more specifically, to the Doctor of Philosophy program in Community Health, one of the flagship offerings of an institution that has, over the past 19 years, established itself as a global leader in high-quality, accessible, online graduate education. TBUGE USA was founded more than 2 decades, but became officially established in the year 2006 by Reverend Professor Adelik Daniel Jurojai, an educator, scholar, and administrator, whose career spans 5 decades and multiple continents. Professor Jurojai holds earned doctorates in ministry and education, multiple honorary doctorates from peer institutions, and a distinguished record of institution building that is virtually without parallel in the field of distance and professional doctoral education. Under his leadership, what began as a modest initiative to extend graduate opportunities to working adults in underserved regions has grown into a fully accredited university system with headquarters in New York, active extension centers on 4 continents, and more than 12,000 master's and doctoral alumni currently serving in 87 countries. Professor Jurojai's vision was straightforward yet ambitious: to create a rigorously academic, ethically grounded, and globally accessible university that removes traditional barriers, geography, cost, and inflexible scheduling, while maintaining standards that compete with the world's leading research institutions. That vision is now reality. TBUGE USA holds institutional accreditation recognized by the U.S. Department of Education and the Council for Higher Education Accreditation, and its graduates occupy senior positions at the World Health Organization, the Centers for Disease Control and Prevention, UNICEF, National Ministries of Health, major research universities, and leading non-governmental organizations. The Community Health Doctoral Program you have joined reflects Professor Jurojai's lifelong commitment to combining scholarly excellence with real-world impact. From its inception, he insisted that every course, every policy, and every support service be designed with one question in mind: how does this help our graduates improve health outcomes in the communities they serve? The result is a curriculum that is methodologically state-of-the-art, deliberately interdisciplinary, and intentionally oriented toward actionable, equity-focused scholarship. You will benefit from infrastructure that few online programs can match: unlimited dissertation writing support, 24-hour quantitative consultation, guaranteed research funding, community co-advisors with decision-making authority, and a global network of field partnerships that provide immediate outlets for your work. These resources exist because Professor Jurojai has consistently reinvested institutional revenue into student success rather than administrative overhead, maintaining tuition levels that remain among the most competitive for accredited US-based doctoral programs. Throughout your studies, you will encounter the direct influence of our founder's leadership philosophy: intellectual rigor without arrogance, accessibility without compromise, and a steadfast belief that scholarship is most valuable when it is placed in service of human dignity. His personal practice of reviewing strategic initiatives, mentoring select dissertation cohorts, and remaining available to students regardless of time zone has become part of the institutional culture you now enter. You are joining a community of scholars who have published in The Lancet, Health Affairs, and the American Journal of Public Health, who have shaped national health policy in more than 30 countries, and who have founded community health centers, data cooperatives, and advocacy organizations that continue to save and improve lives long after graduation. This is the standard Professor Jurojai set, and it is the standard you are now invited to meet, and ultimately to exceed. On behalf of the faculty, staff, and worldwide alumni network, I congratulate you on your admission and extend our full commitment to your success. The foundation built by Professor Adelik Daniel Jurojai over nearly 2 decades is now yours to stand upon, to build upon, and to extend to the next generation of community health leaders. Welcome to Triune Biblical University Global Extension USA. Your work here matters. We are honored to walk with you. Program description. Our Community Health Doctoral Program prepares scholars to address complex public health challenges through advanced research, leadership, and community engagement. Program goals. Develop advanced research methodology expertise. Foster innovative community health solutions. Cultivate leadership in health equity and policy. Advance knowledge through rigorous scholarship. Career paths. Academic research and teaching positions. Public health leadership roles. Policy development and advocacy. Community health program administration. Program description. In the realm of public health, where the intricacies of societal well-being intersect with scientific inquiry, our Community Health Doctoral Program stands as a beacon for aspiring scholars. This program is meticulously designed to equip individuals with the tools necessary to confront the multifaceted challenges that plague communities worldwide. At its core, the program emphasizes advanced research, which serves as the foundation for uncovering evidence-based solutions to pressing health issues. Imagine delving into epidemiological studies that reveal patterns of disease transmission in urban slums, or analyzing data from global health crises to predict future outbreaks. Through rigorous methodological training, students learn to design studies that are not only statistically sound, but also ethically grounded, ensuring that research contributes meaningfully to the field. Leadership is another pillar of this program, fostering the ability to guide teams, influence policy, and drive change at various levels of society. Doctoral candidates are encouraged to step into roles where they can advocate for underrepresented populations, perhaps leading initiatives to combat health disparities in rural areas, or spearheading vaccination campaigns in the face of vaccine hesitancy. This leadership training goes beyond theoretical knowledge. It involves practical experiences, such as internships with health organizations, where students might collaborate with policymakers to draft legislation aimed at improving access to healthcare. Community engagement forms the third essential component, bridging the gap between academia and the real world. In this program, scholars are immersed in participatory action research, where they work hand-in-hand with community members to identify needs and co-create interventions. Picture a scenario where a doctoral student partners with a local nonprofit to develop a nutrition program for low-income families, incorporating cultural sensitivities and feedback from the participants themselves. This approach ensures that solutions are not imposed from above, but emerge from within the communities they serve, promoting sustainability and empowerment. The program's curriculum is interdisciplinary, drawing from fields like sociology, environmental science, and economics to provide a holistic view of public health. Courses might include advanced biostatistics, where students learn to model the impact of climate change on vector-borne diseases, or qualitative research methods that explore the lived experiences of individuals affected by mental health stigma. Seminars feature guest speakers from international health agencies, offering insights into global challenges such as pandemics or non-communicable diseases. Moreover, the program emphasizes ethical considerations, teaching scholars to navigate issues like informed consent in vulnerable populations, or the equitable distribution of research benefits. As scholars progress, they undertake a dissertation that represents the culmination of their training, an original piece of research that addresses a gap in community health knowledge. This could range from evaluating the effectiveness of telehealth services in remote areas to studying the social determinants of obesity in immigrant communities. The program's faculty, comprised of renowned experts with extensive publication records, provide mentorship every step of the way, ensuring that graduates emerge not just as researchers, but as changemakers ready to tackle the complexities of public health. The integration of these elements, research, leadership, and engagement, creates a transformative educational experience. Students are challenged to think critically about systemic issues, such as how socioeconomic inequalities exacerbate health outcomes, or how cultural barriers hinder preventive care. Through field work placements, they gain first-hand exposure to diverse settings, from urban health clinics to international aid projects. This hands-on approach builds resilience and adaptability, qualities essential for navigating the ever-evolving landscape of public health threats, including emerging infectious diseases and the growing burden of chronic conditions. Furthermore, the program fosters a collaborative environment where peers from varied backgrounds share perspectives, enriching the learning process. Group projects might simulate real-world scenarios, like responding to a public health emergency, requiring teams to coordinate resources and communicate findings effectively. Technology plays a key role, with training in data visualization tools and geographic information systems, GIS, to map health trends spatially. By the end of the program, scholars are prepared to disseminate their work through publications, conferences, and community forums, amplifying their impact beyond academia. In essence, our community health doctoral program is more than an academic pursuit, it's a commitment to social justice and human flourishing. It prepares scholars to address complex public health challenges by blending intellectual rigor with compassionate action, ensuring that their contributions lead to healthier, more equitable communities. Program goals. Let us now delve into the specific goals that underpin this doctoral program, each designed to build upon the foundational description we've explored. First, the program aims to develop advanced research methodology expertise. This goal is central because robust research is the engine driving progress in public health. Students begin with foundational courses in quantitative methods, learning to apply statistical models like regression analysis to large datasets from health surveys. For instance, they might analyze data from the National Health and Nutrition Examination Survey, NANES, to identify correlations between dietary habits and cardiovascular disease. As they advance, the focus shifts to mixed methods approaches, combining surveys with in-depth interviews to capture nuanced insights into health behaviors. Expertise in research design is emphasized, teaching scholars to formulate hypotheses, select appropriate sampling techniques, and ensure validity and reliability in their studies. Ethical training is integrated, covering topics like institutional review board, IRB, protocols, and protecting human subjects. Practical labs allow students to use software such as SPSS, R, or SAS for data analysis, perhaps simulating a study on the efficacy of community-based interventions for smoking cessation. By mastering these methodologies, graduates can conduct research that withstands peer review and informs evidence-based practices. Moreover, the program encourages innovation in methodology, such as incorporating big data analytics or machine learning to predict health trends. A student might develop a model using Python to forecast the spread of infectious diseases based on social media data, highlighting how technology enhances traditional methods. This expertise not only prepares scholars for academic rigor, but also for real-world applications where quick, accurate insights can save lives. The second goal is to foster innovative community health solutions. Innovation here means thinking creatively to address entrenched problems. The program encourages students to identify gaps in current health systems and propose novel interventions. For example, a scholar might design a mobile app that connects underserved populations with mental health resources, tailored to cultural contexts. Workshops on design thinking guide students through ideation, prototyping, and testing phases, ensuring solutions are user-centered. Collaboration with community partners is key, where students conduct needs assessments to uncover specific challenges, such as food insecurity in urban areas. They then brainstorm solutions, perhaps integrating sustainable agriculture with health education programs. Case studies from successful innovations, like community-led HIV prevention in sub-Saharan Africa, inspire students to adapt proven strategies to new contexts. The program also explores funding mechanisms, teaching how to write grants for innovative projects, ensuring ideas can be scaled. Sustainability is a core principle, with emphasis on solutions that endure beyond initial implementation. Students learn to evaluate long-term impacts using frameworks like the REAIM model, REACH, effectiveness, adoption, implementation, maintenance. Through capstone projects, they might pilot an innovative solution, such as a peer support network for diabetes management in Indigenous communities, gathering feedback to refine it. This goal cultivates a mindset of creativity and practicality, empowering scholars to drive meaningful change. Third, the program seeks to cultivate leadership in health equity and policy. Leadership in this context involves advocating for fair health outcomes and influencing systemic change. Courses on health policy analysis teach students to dissect legislation, such as the Affordable Care Act, and assess its impact on equity. They learn to craft policy briefs, arguing for reforms like expanding Medicaid to cover preventive services for low-income groups. Equity-focused training addresses disparities based on race, gender, socioeconomic status, and geography. Students explore social determinants of health through lenses like critical race theory, understanding how structural racism affects access to care. Leadership development includes skills in communication, negotiation, and team management, perhaps through role-playing scenarios where they lead a coalition to address opioid addiction in rural communities. Policy advocacy is hands-on, with opportunities to testify at public hearings or collaborate with organizations like the World Health Organization. The program emphasizes ethical leadership, ensuring decisions prioritize marginalized voices. By graduation, scholars are poised to lead initiatives that promote health equity, such as developing policies for universal health coverage or addressing environmental justice in polluted neighborhoods. Finally, the program aims to advance knowledge through rigorous scholarship. This goal underscores the importance of contributing original insights to the field. Students are trained in literature review techniques, synthesizing existing research to identify knowledge gaps. For instance, they might review studies on climate change and vector-borne diseases to propose new research agendas. Rigorous scholarship involves peer-reviewed publishing, with guidance on manuscript preparation and submission to journals like the American Journal of Public Health. Conferences provide platforms to present findings, honing presentation skills. The dissertation process exemplifies this, requiring a comprehensive, defensible contribution, perhaps a longitudinal study on the effects of housing policies on mental health. Interdisciplinary collaboration enriches scholarship, encouraging partnerships with experts in related fields. The program fosters a culture of inquiry, where questioning assumptions leads to breakthroughs. Ultimately, this goal ensures that graduates not only consume knowledge, but actively expand it, pushing the boundaries of community health understanding. Career paths. Having outlined the program's goals, it's essential to consider the diverse career paths available to graduates, each leveraging the skills acquired. One prominent path is academic research and teaching positions. Graduates often secure roles as professors or researchers at universities, where they conduct studies and educate the next generation. For example, a scholar might lead a research lab investigating social determinants of health, publishing findings that shape curricula. Teaching involves designing courses on epidemiology or health promotion, using interactive methods like case-based learning to engage students. In academia, opportunities extend to grant-funded projects, collaborating on multi-institutional studies. Positions at research institutes, such as the Centers for Disease Control and Prevention (CDC), allow for applied research, translating findings into practice. This path suits those passionate about mentorship, as they guide undergraduates and doctoral students through theses. Advancement might lead to department chairs or deanships, influencing institutional policies on health education. Another avenue is public health leadership roles. These positions involve directing organizations or programs at local, state, or national levels. A graduate could become a health department director, overseeing responses to outbreaks like COVID-19, coordinating with stakeholders for effective interventions. Leadership here requires strategic planning, budget management, and crisis response, skills honed in the program. Roles in nonprofits or international agencies, such as UNICEF, focus on global health leadership, perhaps managing programs for maternal and child health in developing countries. These positions demand cultural competence and the ability to navigate political landscapes, ensuring initiatives aligned with community needs. Career progression might include executive roles, shaping organizational visions for health improvement. Policy development and advocacy represent a dynamic career path. Graduates work as policy analysts or advisors, influencing legislation to address health inequities. For instance, they might draft policies for tobacco control or environmental regulations, using evidence from their research to advocate before lawmakers. Advocacy roles with organizations like the American Public Health Association involve lobbying, public campaigns, and coalition building. This path is ideal for those driven by social justice, as they push for reforms like paid sick leave or anti-discrimination laws in healthcare. Opportunities in think tanks allow for in-depth policy research, producing reports that inform national debates. Lastly, Community Health Program Administration offers hands-on management roles. Administrators oversee clinics, wellness centers, or outreach programs, ensuring efficient operations and quality care. A graduate might manage a community health center, implementing programs for chronic disease management and evaluating their outcomes. This path involves staff supervision, resource allocation, and partnership development with local entities. In larger systems, roles could include hospital administration focused on community outreach, integrating services like mental health support. Advancement leads to senior positions, such as chief executive officers of health networks, where strategic decisions impact thousands. These career paths illustrate the versatility of the Community Health Doctoral program, allowing graduates to apply their expertise in ways that align with their passions and strengths, ultimately contributing to healthier societies. Curriculum structure. Year 1. Advanced Epidemiology. Advanced Biostatistics. Advanced Health Policy. Advanced Health Economics. Advanced Program Evaluation. Advanced Social Determinants. Advanced Global Health. Advanced Health Promotion. Year 2. Advanced Qualitative Research. Advanced Quantitative Research. Advanced Environmental Health. Advanced Health Disparities. Community-based participatory research. Advanced Health Communication. Advanced Health Behavior Change. Advanced Health Equity. Year 3. Advanced Community Assessment. Advanced Health Program Planning. Advanced Health Informatics. Advanced Grant Writing. Advanced Policy Advocacy. Advanced Health Education. Advanced Research Methodology. Dissertation. Electives. Advanced Public Health Leadership. Advanced Health Systems Management. Advanced Cultural Competency. Advanced Disaster Preparedness. Advanced Occupational Health. Advanced Maternal and Child Health. Advanced Aging and Public Health. Advanced Community Health Economics. Curriculum structure. In the Community Health Doctoral Program at TBUGE USA, our online university dedicated to fostering global excellence in public health education, the curriculum is thoughtfully structured to provide a comprehensive, progressive journey toward expertise in addressing community health challenges. This structure is divided into 3 years of core coursework, culminating in a dissertation, with additional electives to tailor the experience to individual interests. Delivered entirely online, the program leverages interactive platforms, virtual simulations, and collaborative tools to ensure that distance learning feels immersive and connected. Each year builds upon the previous, starting with foundational advanced concepts in Year 1, deepening methodological skills in Year 2, and focusing on application and synthesis in Year 3. This scaffolded approach allows doctoral candidates to develop from knowledgeable researchers into innovative leaders capable of driving health equity. The curriculum integrates asynchronous lectures, synchronous discussions, and project-based assessments, accommodating the diverse schedules of working professionals. By emphasizing real-world applicability, the structure ensures that every course contributes to the overarching goal of preparing scholars to tackle complex public health issues through evidence-based strategies and community-centered solutions. Year 1. The first year of the doctoral program lays the groundwork by immersing students in advanced theoretical and analytical frameworks essential for community health scholarship. This foundational phase is designed to sharpen critical thinking and provide the tools needed to analyze health data, policies, and systems on a broad scale. Advanced epidemiology. Epidemiology, often called the backbone of public health, takes center stage in this advanced course, where we delve into the intricate patterns of disease distribution and determinants within communities. At TBUGE USA, this online module explores beyond basic concepts, examining sophisticated models like compartmental modeling for infectious diseases, such as susceptible infectious recovered frameworks applied to modern outbreaks like COVID-19 variants. Students engage in virtual case studies, simulating outbreak investigations using software like EpiInfo to trace transmission chains in hypothetical urban settings. We discuss advanced topics such as causal inference, using directed acyclic graphs (DAGs) to disentangle confounding factors in observational data, and how these apply to chronic conditions like diabetes in underserved populations. Ethical considerations in epidemiological research are woven throughout, including the implications of surveillance on privacy rights. Through online forums, learners debate real-time global events, such as the resurgence of measles due to vaccine hesitancy, and design cohort studies to evaluate intervention efficacy. Assignments include analyzing large datasets from sources like the World Health Organization, WHO, fostering skills in interpreting relative risks and odds ratios. By the end, students master techniques like survival analysis for time-to-event data, preparing them to contribute to predictive modeling in community health crises. Advanced biostatistics. Building on epidemiological principles, advanced biostatistics equips scholars with a quantitative prowess to make sense of complex health data. In this course, we explore multivariable regression models, including logistic and Poisson regressions, to predict health outcomes like hospital readmission rates in low-income communities. Online interactive sessions use R and Python for hands-on coding, where students manipulate datasets to perform hypothesis testing and confidence interval estimation. We cover Bayesian statistics, applying prior distributions to refine estimates in small sample scenarios, such as rare disease prevalence in rural areas. Topics like multilevel modeling address hierarchical data structures, for instance, analyzing how neighborhood factors influence individual health behaviors. The curriculum includes machine learning basics, like random forests for classifying health risks from electronic health records. Ethical biostatistical practices, such as avoiding p-hacking, are emphasized through case reviews of flawed studies. Virtual group projects involve designing surveys and analyzing results with tools like SPSS, culminating in a report on health disparities. This course ensures graduates can critically appraise research and design robust studies that inform community health strategies. Advanced health policy. Health policy shapes the landscape of community well-being, and this advanced course dissects the mechanisms behind policy formulation, implementation, and evaluation. At TBUGE USA, we examine frameworks like Kingdon's multiple streams model to understand how windows of opportunity lead to policy changes, such as expansions in Medicaid under the Affordable Care Act. Online modules include simulations of legislative processes, where students role-play stakeholders debating universal healthcare proposals. We analyze international policies, comparing systems like the UK's National Health Service with the US fragmented approach, highlighting impacts on community access. Topics cover policy analysis tools, including cost-benefit assessments for interventions like smoking bans. Discussions address equity, exploring how policies exacerbate or mitigate disparities in marginalized groups. Assignments involve drafting policy memos on current issues, such as opioid regulation, using evidence from peer-reviewed sources. By integrating guest lectures from policymakers via video, the course prepares students to advocate for evidence-based reforms that enhance community health resilience. Advanced health economics. Economics underpins health decisions, and this course advances understanding of how resources are allocated in community health contexts. We begin with microeconomic principles, applying supply and demand curves to healthcare markets, such as the pricing of generic drugs in underserved areas. Macroeconomic perspectives follow, examining how national budgets influence public health funding, like allocations for pandemic preparedness. Students learn econometric techniques, using instrumental variable analysis to evaluate the economic impact of health interventions, for example, the return on investment in vaccination programs. Online tools facilitate simulations of budget scenarios, where learners optimize resource distribution for community clinics. We discuss health disparities through an economic lens, analyzing how income inequality drives differential access to care. Case studies include global examples, like the cost-effectiveness of malaria nets in sub-Saharan Africa. Ethical dilemmas, such as rationing scarce resources, are debated in forums. Culminating projects require economic modeling of a community health initiative, equipping scholars to inform fiscally sound policies. Advanced program evaluation. Evaluating programs is crucial for ensuring community health initiatives deliver results, and this advanced course provides the methodologies to do so rigorously. We cover frameworks like logic models to map inputs, outputs, and outcomes, applying them to real-world programs such as obesity prevention in schools. Online sessions teach quasi-experimental designs, like difference in differences, to assess causality without randomization. Students use software like Stata for data analysis, evaluating metrics such as reach and sustainability. Topics include mixed methods evaluation, integrating qualitative feedback with quantitative data for holistic insights. We address challenges in community settings, such as cultural barriers to participation. Ethical evaluation practices, including stakeholder involvement, are emphasized. Virtual case studies involve critiquing evaluations of programs like WIC Women, Infants, and Children, identifying biases. Assignments culminate in designing an evaluation plan for a hypothetical community intervention, preparing graduates to enhance program effectiveness through evidence. Advanced social determinants. Social determinants profoundly influence health, and this course advances knowledge of these non-medical factors. We explore models like the WHO's Commission on Social Determinants of Health, dissecting how education, housing, and employment shape outcomes. Online discussions analyze intersections, such as how racism compounds poverty in health disparities. Students map determinants using GIS tools, visualizing correlations between neighborhood deprivation and chronic disease rates. Topics include upstream interventions, like policy changes for affordable housing to reduce asthma triggers. We examine global variations, comparing determinants in high-income versus low-income countries. Ethical considerations involve advocating for equity without stigmatizing communities. Assignments include literature reviews on specific determinants, like food insecurity, and proposing interventions. This course empowers scholars to address root causes, fostering holistic community health approaches. Advanced global health. Global health transcends borders, and this advanced course examines interconnected challenges like pandemics and climate impacts. We study frameworks such as the Sustainable Development Goals, SDGs, focusing on health-related targets. Online modules include case analyses of Ebola responses, highlighting coordination failures and successes. Topics cover health diplomacy, negotiating international aid for community programs. Students simulate global health scenarios using decision-making tools. We address inequities, such as vaccine distribution disparities. Ethical issues, like research in low-resource settings, are debated. Projects involve proposing global-local linkages, like adapting WHO guidelines for U.S. communities. Graduates emerge ready to contribute to worldwide health equity. Advanced health promotion. Promoting health prevents illness, and this course advances strategies for community-level change. We explore models like the Ottawa Charter, emphasizing empowerment and policy. Online activities include designing campaigns using social marketing, targeting behaviors like physical activity in sedentary populations. Topics cover digital promotion, leveraging apps for health tracking. Students analyze barriers, such as cultural norms, and evaluate promotion efficacy with metrics like behavior change rates. Ethical promotion avoids coercion. Case studies review successful initiatives, like anti-smoking efforts. Assignments culminate in a promotion plan, equipping scholars to lead preventive efforts. Year 2. Year 2 shifts focus to advanced research methods and specialized topics, building analytical depth and preparing students for independent inquiry in community health. Advanced qualitative research. Qualitative research uncovers lived experiences, and this advanced course hones skills in methods like grounded theory and phenomenology. We teach data collection via virtual interviews, analyzing themes with in vivo software. Topics include reflexivity to mitigate bias. Students explore community narratives, such as immigrant health stories. Ethical consent in sensitive topics is emphasized. Projects involve full qualitative studies, from design to interpretation, enhancing nuanced understanding. Advanced quantitative research. Quantitative research quantifies patterns, advancing from year 1 with complex designs like longitudinal studies. We cover advanced statistics, including structural equation modeling for latent variables like health literacy. Online labs use SAS for big data handling. Topics include survey validation and power analysis. Ethical data use avoids misrepresentation. Assignments analyze public datasets, preparing for rigorous quantification. Advanced environmental health. Environmental factors affect communities, and this course examines pollutants and climate effects. We study risk assessment models for toxins like lead in water. Online simulations model exposure scenarios. Topics include policy responses to environmental justice. Students map health-environment links with GIS. Ethical advocacy for vulnerable groups is key. Projects propose mitigation strategies. Advanced health disparities. Disparities stem from systemic issues, and this advanced course dissects mechanisms like discrimination. We use frameworks like intersectionality to analyze overlapping oppressions. Online discussions review data on racial gaps in outcomes. Topics include intervention design for equity. Ethical research amplifies voices. Assignments involve disparity audits. Community-based participatory research. CBPR partners with communities, co-creating knowledge. This course teaches principles like shared decision-making. Online collaborations simulate partnerships. Topics include power-sharing ethics. Students design CBPR projects, ensuring sustainability. Advanced health communication. Effective communication drives change, advancing skills in tailoring messages. We cover theories like the health belief model. Online exercises craft campaigns for diverse audiences. Topics include misinformation combat. Ethical transparency is emphasized. Projects evaluate communication impacts. Advanced health behavior change. Behavior change theories guide interventions, advancing models like trans-theoretical stages. We analyze nudges for habits like diet. Online role-plays test strategies. Topics include cultural adaptations. Ethical non-manipulation is key. Assignments design change programs. Advanced health equity. Equity ensures fair opportunities, advancing advocacy strategies. We examine metrics like Gini coefficients for health. Online forums debate reforms. Topics include global equity frameworks. Ethical prioritization of marginalized. Projects propose equity plans. Year 3. The final year emphasizes application, synthesis, and original contribution through advanced topics and the dissertation. Advanced community assessment. Assessing needs identifies priorities, advancing tools like rapid appraisals. We teach mixed methods for comprehensive views. Online fieldwork simulations gather data. Topics include asset mapping. Ethical community involvement. Projects conduct virtual assessments. Advanced health program planning. Planning translates assessments into action, using models like Proceed. We cover stakeholder engagement. Online planning exercises develop logic models. Topics include budgeting. Ethical inclusivity. Assignments create full plans. Advanced health informatics. Informatics leverages data for health, advancing EHR analysis. We teach data mining with Python. Online labs handle big data. Topics include privacy laws like HIPAA. Ethical AI use. Projects design informatics systems. Advanced grant writing. Funding sustains work, advancing proposal crafting. We cover NE formats. Online workshops refine narratives. Topics include budgeting justification. Ethical transparency. Assignments submit mock grants. Advanced policy advocacy. Advocacy influences change, advancing lobbying skills. We simulate testimonies. Online networks build coalitions. Topics include media strategies. Ethical evidence-based claims. Projects lead advocacy campaigns. Advanced health education. Education empowers, advancing adult learning theories. We design curricula for communities. Online modules test facilitation. Topics include evaluation. Ethical cultural sensitivity. Assignments develop education programs. Advanced research methodology. Integrating methods, this capstone refines designs. We cover hybrid approaches. Online critiques strengthen proposals. Topics include rigor standards. Ethical IRB navigation. Prepares for dissertation. Dissertation. The dissertation represents original scholarship, addressing a community health gap. Guided by committees via online meetings, students propose, collect data, and defend. Topics range from disparities to interventions. Ethical oversight ensures impact. Culminates in publication-ready work. Electives. Electives allow specialization, enhancing core curriculum with targeted expertise. Advanced public health leadership. Leadership mobilizes teams, advancing styles like transformational. We simulate crises. Online case studies review leaders. Topics include ethics. Projects develop leadership plans. Advanced health systems management. Management optimizes delivery, advancing operations research. We cover quality improvement. Online tools model workflows. Topics include finance. Ethical equity. Assignments manage hypothetical systems. Advanced cultural competency. Competency bridges cultures, advancing self-awareness training. We explore biases. Online interactions practice skills. Topics include inclusive care, ethical respect, projects design competency programs, advanced disaster preparedness. Preparedness mitigates risks, advancing response planning. We simulate emergencies. Online drills test protocols. Topics include resilience, ethical resource allocation. Assignments create plans. Advanced occupational health. Workplace health protects workers, advancing ergonomics. We analyze hazards. Online assessments evaluate risks. Topics include policy, ethical safety. Projects propose improvements. Advanced maternal and child health. Focusing on vulnerable groups, advancing interventions like prenatal care. We review global indicators. Online cases address disparities. Topics include nutrition, ethical family-centered. Assignments design programs. Advanced aging and public health. Aging populations need support, advancing gerontology. We cover chronic care. Online discussions on policies. Topics include elder abuse, ethical dignity. Projects plan aging services. Advanced community health economics. Economics in communities, advancing cost analyses. We model local impacts. Online tools forecast budgets. Topics include equity, ethical allocation. Assignments evaluate initiatives. Year 1 core courses. CH 901 Advanced Epidemiology. Study of disease patterns in populations. Research design and analysis methods. Foundational for community health research. CH 902 Advanced Biostatistics. Statistical methods for health data. Complex modeling techniques. Essential for quantitative research. CH 903 Advanced Health Policy. Health policy analysis and development. Healthcare systems and reform. Impact on community health outcomes. CH 904 Advanced Health Economics. Economic evaluation of health programs. Resource allocation and cost effectiveness. Financial sustainability of interventions. CH 905 Advanced Program Evaluation. Evaluation frameworks and methodologies. Measuring program effectiveness. Evidence-based program improvement. CH 906 Advanced Social Determinants. Social factors influencing health. Health disparities and inequities. Systems thinking approach. CH 907 Advanced Global Health. Global health challenges and solutions. International health systems. Cross-cultural health perspectives. CH 908 Advanced Health Promotion. Theoretical foundations of health promotion. Community-based interventions. Behavior change strategies. ##### Year 1 core courses. The first year of the TBUGE USA online doctoral program in community health is deliberately constructed as an intensive, interconnected foundation that transforms experienced public health professionals into rigorous community health scholars. All 8 core courses are delivered through our advanced virtual learning environment, combining asynchronous high-definition lectures, real-time interactive seminars, live data analysis workshops, and collaborative project spaces that replicate the intensity of on-campus doctoral training while offering the flexibility required by global professionals. Each course is worth 4 credits, runs for 10 weeks, and requires a major integrative assignment that contributes to the student's evolving research portfolio. CH 901 Advanced Epidemiology. The opening cornerstone of the doctoral journey, advanced epidemiology moves far beyond introductory principles and immerses students in the sophisticated study of disease patterns in populations at the community, national, and global levels. From the first week, learners engage with dynamic, real-time disease mapping exercises using actual surveillance data streamed from CDC Wonder, WHO, and state health departments. We explore advanced measures of association, risk ratios, odds ratios, population attributable fractions, and their proper interpretation in the presence of effect modification and interaction. Students master the construction and critical appraisal of directed acyclic graphs, DAGs, to identify confounding and selection bias in observational studies, then apply these tools to contemporary community problems such as the led epidemiology of cardiometabolic disease in food desert neighborhoods. Research design and analysis methods form the backbone of the second half of the course. Doctoral candidates design complex cohort, case control, and case cohort studies, learning when and how to employ restricted cubic splines for nonlinear exposure outcome relationships, time-varying exposures, and competing risks in survival analysis. We dedicate entire modules to causal inference frameworks, counterfactuals, potential outcomes, G-estimation, and marginal structural models, using inverse probability of treatment weighting to estimate community-level intervention effects when randomization is impossible. Practical sessions in IRON SAS walk students through propensity score matching, calibration, and sensitivity analyses for unmeasured confounding. The capstone assignment requires students to develop a complete epidemiologic investigation protocol for a current community health threat, e.g., the resurgence of syphilis in rural counties or vaping-related lung injury clusters, including power calculations, bias analysis plan, and a detailed dissemination strategy for local health departments. By the end of CH.901, students possess the methodological sophistication to serve as principal investigators on community-based epidemiologic research and to critically dismantle flawed studies published in high-impact journals. CH 902 Advanced Biostatistics. Immediately reinforcing epidemiologic rigor, advanced biostatistics equips scholars with the statistical firepower demanded by modern community health research. The course opens with a deep dive into likelihood-based inference and maximum likelihood estimation, rapidly progressing to generalized linear models, mixed effects models, and generalized estimating equations for clustered and longitudinal community data. Students learn to handle missing data through multiple imputation with chained equations and full information maximum likelihood, then apply these techniques to real datasets from the Behavioral Risk Factor Surveillance System, BIFSS, and the Youth Risk Behavior Survey. Complex modeling techniques dominate the latter weeks. Hierarchical Bayesian modeling using STAN and JAGs for small area estimation of health indicators when direct survey estimates are unstable. Joint modeling of longitudinal and survival data to study trajectories of glycemic control and mortality in safety net clinic populations. Machine learning integration, lasso, ridge regression, random forests, and gradient boosting for predictive modeling of hospital readmission risk among Medicaid enrollees. Special sessions address spatial statistics and geostatistical modeling using integrated nested Laplace approximations, INLA, to map disease risk across census tracts. Every modeling decision is framed within the context of community health equity. Students must explicitly demonstrate how their chosen methods reduce or exacerbate bias against historically marginalized groups. The final project is a peer-reviewed, level statistical analysis plan, an executed analysis of a publicly available complex survey dataset, complete with reproducible, markdown code, diagnostic plots, and a plain language interpretation suitable for community stakeholders. Graduates leave CH.902 able to design, execute, and defend the quantitative core of grant applications and manuscripts in the most demanding journals. CH 903 Advanced Health Policy. Policy is the lever that translates evidence into population-level change. An advanced health policy provides doctoral students with the analytical and strategic tools to shape it. The course begins with advanced policy analysis frameworks, Kingdon's multiple streams, punctuated equilibrium theory, and advocacy coalition frameworks, applied to real-time legislative battles such as Medicare drug price negotiation or state-level Medicaid expansion debates. Students dissect the political economy of health reform, learning to trace money and influence through open secrets and state lobbying databases. Healthcare systems and reform modules compare the U.S. hybrid system with single-payer, social health insurance, and national health service models worldwide, using OECD and Commonwealth Fund data to quantify access, quality, and cost outcomes. We conduct in-depth case studies of transformative reforms, the Affordable Care Act's impact on community health center funding, Massachusetts Chapter 58 experiment, and Oregon's Medicaid prioritization process. Students master cost-benefit, cost-effectiveness, and budget impact modeling from a governmental perspective, learning to construct Markov models of policy scenarios in Triage and Excel. The final third of the course focuses on the impact on community health outcomes, requiring students to link policy levers, insurance expansion, provider payment reform, scope of practice laws, to measurable changes in preventable hospitalizations, maternal mortality, and life expectancy at the county level. Each student selects a current or proposed policy affecting an underserved U.S. community, produces a professional policy brief, delivers a simulated testimony before a mock legislative committee via our virtual hearing platform, and drafts model statutory language. By graduation from CH.903, students are fully prepared to serve as expert advisors to legislators, health commissioners, and advocacy organizations. CH.904 Advanced Health Economics. Where policy identifies what should be done, health economics determines what can be afforded and how to maximize value. Advanced health economics begins with welfare economics and the theoretical justification for public intervention in health markets, externalities, information asymmetry, and equity concerns. Students rapidly advance to economic evaluation of health programs, mastering the construction of decision analytic models, decision trees, microsimulation, and agent-based models, to compare interventions ranging from syringe exchange programs to community-wide hypertension screening initiatives. Resource allocation and cost-effectiveness dominate the curriculum. Learners conduct threshold analyses, compute net monetary benefits across willingness-to-pay ranges, and grapple with distributional cost-effectiveness analysis that explicitly weights outcomes for disadvantaged populations. We dissect controversies in cost-effectiveness, QALYs versus dailies, equity weighting, and the social value of reducing health inequality, using real examples from the second panel on cost-effectiveness in health and medicine. Advanced topics include value-based payment design, risk adjustment methodologies, and the economics of social determinants interventions, housing first programs, income supplements. The signature assignment is a full cost-effectiveness analysis of a student-designed community health intervention, complete with probabilistic sensitivity analysis, value of information analysis, and a budget impact model for a state Medicaid program. The final deliverable meets the standards expected by the Institute for Clinical and Economic Review, ICER, and is often publishable in Health Affairs or Medical Care. CH 905 Advanced Program Evaluation. No intervention survives first contact with reality unchanged, making rigorous evaluation indispensable. Advanced Program Evaluation trains students to measure program effectiveness with scientific precision while maintaining community trust. We begin with the philosophical and practical distinctions between summative and formative evaluation, then explore advanced frameworks, realist evaluation, contribution analysis, and empowerment evaluation, particularly suited to complex community interventions. Students master both experimental and quasi-experimental designs, cluster randomized trials, stepped wedge designs, regression discontinuity, and interrupted time series with segmented regression. We devote significant time to implementation science outcomes using the REAIM and CFIR frameworks, teaching students to measure fidelity, adaptation, reach, and maintenance simultaneously with effectiveness. Mixed methods evaluation receives equal weight. Learners integrate qualitative data from community stakeholders into quantitative impact estimates using joint displays and Bayesian integration techniques. A 2-week module on rapid cycle evaluation and learning health systems prepares students to evaluate programs in politically charged, resource-constrained environments. The capstone is a complete evaluation plan for an existing community health program. Students may select from a menu of partner organizations or propose their own, including stakeholder engagement strategy, theory of change, mixed methods data collection tools, analysis plan, and dissemination approach tailored to funders and community audiences. Graduates emerge capable of leading CDC or near-level evaluations. Ch. 906 Advanced Social Determinants. Understanding that clinical care explains only a fraction of health outcomes, advanced social determinants forces students to confront the upstream drivers of community well-being. We begin with the WHO conceptual framework and move quickly to cutting-edge systems thinking, causal loop diagrams, agent-based modeling of neighborhood effects, and network analysis of social capital. Students learn to operationalize and measure structural determinants, residential segregation using dissimilarity indices, income inequality via Gini and Thiel indices, and structural racism through novel composite indices. Health disparities and inequities are examined at multiple levels, between group versus within group inequality, gradient versus threshold effects, and life course versus contemporaneous impacts. We explore fundamental cause theory, weathering hypothesis, and minority stress models, applying them to empirical data from EdHealth, panel study of income dynamics, and the regards cohort. A full module addresses intersectionality and multi-level determinants, teaching students to use cross-classified and multiple membership models when individuals belong to several marginalized identities simultaneously. The final project requires students to develop a systems map of social determinants influencing a specific community health outcome in a chosen locality, identify leverage points for intervention, and propose a multi-sector policy strategy with measurable intermediate outcomes. This course fundamentally reshapes how students conceptualize health problems, moving them from individual pathology to structural transformation. Ch. 907 Advanced Global Health. Even scholars focused on U.S. communities must understand the global forces shaping local realities. Advanced Global Health examines pandemics, migration, trade, and climate change as determinants of community health everywhere. We begin with the political economy of global health governance, WHO, Global Fund, Gavi, and the growing role of philanthropic actors, and critically assess power imbalances in priority setting. Students conduct country case studies using the Lancet Commission frameworks, comparing health system resilience across income levels. International health systems are dissected using the WHO building blocks and control knobs frameworks, with particular attention to community health worker programs, primary health care revitalization post-Almata, and the diagonal approach to disease-specific versus system strengthening. We explore decolonizing global health movements and participatory approaches to knowledge production. Advanced topics include syndemic theory applied to HIV, violence, and substance use, the double burden of malnutrition, and planetary health perspectives on community resilience. The signature assignment is a comparative analysis of how two countries address the same global health threat, e.g., COVID-19, antimicrobial resistance, and extraction of lessons for U.S. community health practice. Students present their findings in a simulated UN-side event, complete with policy recommendations and coalition-building strategy. Ch. 908 Advanced Health Promotion. The year concludes with advanced health promotion, synthesizing everything learned into proactive, population-level strategies. We begin with critical analysis of traditional health behavior theories, health belief model, theory of planned behavior, social cognitive theory, and their limitations in structural contexts, then move to ecological models, socio-ecological frameworks, and settings-based approaches emphasized in the Ottawa and Bangkok charters. Community-based interventions form the practical core. Students design, cost, and evaluate multi-level interventions using intervention mapping protocol, addressing issues such as youth violence prevention, healthy food environments, or active transportation. We explore community organizing and asset-based community development, ABCD, alongside traditional risk factor approaches, requiring students to integrate principles of popular education and empowerment. Advanced behavior change strategies include nudge theory, habit formation science, motivational interviewing at scale, and digital health promotion using behavioral design principles. The final deliverable is a comprehensive community health promotion plan for a real partner community, complete with theory of change, multi-channel intervention mix, process and outcome evaluation plan, sustainability strategy, and advocacy component. Students defend their plans before a panel of community leaders and faculty in a live virtual town hall format. By completing CH.908, students have not only mastered the first-year curriculum, but have produced portfolio pieces ready for grant applications and community partnerships. Together, these 8-year 1 core courses at TBUGE USA create an unparalleled foundation of analytical depth, systems thinking, and practical skill that propels doctoral candidates into the specialized and generative work of years 2 and 3 with confidence and vision. Year 2 core courses. CH 909 Advanced Qualitative Research. Interview and Focus Group Methods. Narrative and Ethnographic Approaches. Rich Data Collection Techniques. CH 910 Advanced Quantitative Research. Advanced Statistical Modeling. Survey Design and Validation. Big Data Analysis Methods. CH 911 Advanced Environmental Health. Environmental Health Risks. Climate Change and Health Impacts. Sustainable Health Practices. CH 912 Advanced Health Disparities. Structural Determinants of Health. Intersectionality and Health Equity. Targeted Interventions for Vulnerable Groups. CH 913 Community-Based Participatory Research. Collaborative Research Methodologies. Community Engagement Strategies. Co-creation of Knowledge. CH 914 Advanced Health Communication. Health Message Development. Media and Digital Health Strategies. Culturally Tailored Communication. CH 915 Advanced Health Behavior Change. Behavioral Theories and Models. Intervention Design and Implementation. Sustainable Behavior Modification. CH 916 Advanced Health Equity. Social Justice Frameworks. Equity-Focused Policy Development. Transformative Approaches to Health. Year 2 Core Courses. TBUGE USA Doctoral Program in Community Health. Year 2 represents a pivotal transformation. Having mastered the foundational sciences in Year 1, students now move into advanced methodological mastery, critical theoretical lenses, and the practical arts of partnership, communication, and transformative action. Delivered entirely through TBUGE USA's immersive online platform, each 4-credit, 10-week course combines live methodological workshops, real-time community partner consultations, collaborative data labs, and intensive peer review cycles that mirror the rigor of the world's leading research universities while remaining fully accessible to working professionals worldwide. CH 909 Advanced Qualitative Research. Advanced qualitative research is designed to produce scholars who do not merely use qualitative methods, but who think, breathe, and create knowledge qualitatively with sophistication and ethical depth. Interview and focus group methods begin at an expert level. Students move beyond basic semi-structured interviewing into advanced techniques. Cognitive interviewing for instrument refinement, elite interviewing with policymakers, longitudinal life history interviews with community elders, and crisis-focused trauma-informed interviewing in disaster-affected neighborhoods. Live online role-plays are recorded and dissected in peer debriefing sessions. Focus group facilitation training includes managing power imbalances when community leaders and residents share the same virtual room, using breakout rooms strategically, and employing projective techniques, photoelicitation, timeline mapping, body mapping, to surface experiences words alone cannot capture. Narrative and ethnographic approaches occupy the middle third of the course. Students conduct virtual mini-ethnographies using digital diaries, WhatsApp voice notes, and participant-generated videos from their own practice communities. We explore narrative analysis, Lebovian structural analysis, positioning theory, and critical narrative intervention, performance ethnography, and autoethnography as legitimate doctoral tools. A 2-week intensive immerses learners in institutional ethnography to map how policies textually mediate frontline community health work. Rich data collection techniques conclude the term. Advanced training covers walking interviews translated to virtual reality Street View platforms, photo voice exhibited in online galleries with community commentary, digital storytelling workshops, and sensory ethnography using soundscapes and smell kits mailed to participants. The entire data life cycle, from ontological and epistemological positioning through transcription controversies, coding with NVivo 14 or Atlas.T24, thematic network analysis, and member checking in community town halls, is practiced on real partner projects. The capstone is a complete qualitative dissertation chapter, typically the first findings chapter, based on original data collected and analyzed during the term, defended in a live virtual data session with community co-researchers present. Ch. 910 Advanced Quantitative Research. Running parallel to qualitative mastery, advanced quantitative research pushes students into the frontier of computational community health science. Advanced statistical modeling opens with flexible regression splines, generalized additive models, GAMs, and penalized regression for high-dimensional social determinant datasets. Students then master longitudinal and panel methods, fixed versus random effects models, growth curve modeling with latent trajectory classes, and cross-lagged panel models to disentangle bidirectional relationships, e.g., poverty-depression versus depression-poverty. 2 intensive weeks focus on causal inference beyond year 1, doubly robust estimation, targeted maximum likelihood estimation, TMLE, and longitudinal G-computation for time-varying exposures and mediators. Survey design and validation receives doctoral-level treatment, total survey error framework, adaptive sampling for hard-to-reach communities, mixed mode, web or phone SMS, optimization, cognitive pretesting via live online probing, and psychometric validation using both classical test theory and item response theory, RASH, and 2-parameter logistic models. Students design and field test their own instruments with real communities. Big data analysis methods dominate the final segment. Natural language processing of electronic health record notes to extract social risk, geospatial modeling with Bayesian Kriging and spatially varying coefficients, network analysis of patient sharing and referral patterns, and introductory deep learning for image-based community assessment, e.g., using satellite imagery to predict neighborhood health. Every assignment requires open science practices, public GitHub repositories, registered analysis plans, and pre-analysis transparency reports. The final deliverable is a complete quantitative manuscript suitable for submission to Annals of Internal Medicine or American Journal of Public Health, including supplementary online code and data. Ch. 911 Advanced Environmental Health. Environmental health in Year 2 reframes climate and place as fundamental determinants of community well-being. Environmental health risks are examined through advanced exposure science, cumulative risk assessment integrating chemical and non-chemical stresses, community-based biomonitoring partnerships, and novel sensors, low-cost air quality monitors co-designed with residents. Students conduct exposure pathway analyses for real communities facing lead, PFAS, or wildfire smoke. Climate change and health impacts form a 4-week intensive. Learners build and parameterize agent-based models of heat-related mortality under different urban heat island mitigation scenarios, quantify attributable fractions for climate-sensitive diseases, and master health impact assessment, HIA, for proposed fossil fuel infrastructure. We explore climate justice frameworks, disproportionate impacts on indigenous communities, low-income neighborhoods, and global South nations, and co-develop adaptation plans with actual frontline communities through live virtual charrettes. Sustainable health practices close the course: green health care delivery, regenerative food systems, nature-based solutions, urban forests, restorative justice gardens, and circular economy approaches to medical waste. The capstone requires students to lead a community academic partnership that produces both a peer-reviewed climate health adaptation plan and a community-facing implementation toolkit. Ch. 912 Advanced Health Disparities. This course moves disparities scholarship from description to interrogation and action. Structural determinants of health are dissected using quantitative, multi-level models of segregation and mortality, and qualitative, critical discourse analysis of policy documents, approaches. Students master indices of concentration at the extremes, ICE, the Public Health Disparate Impact Toolkit, and structural equation modeling of mediated pathways, e.g., redlining wealth preterm birth. Intersectionality and health equity occupy the center of the course. We operationalize intersectionality through intercategorical and intracategorical approaches, quantitative intersectional MIDA models, and qualitative intersectional storytelling. Students conduct intersectional health needs assessments that explicitly examine how race, gender, sexuality, disability, and migration status co-constitute risk. Targeted interventions for vulnerable groups conclude the term: culturally responsive interventions, structural interventions, housing vouchers, reparations pilots, and rights-based approaches. Every student partners with a community organization serving a doubly or triply marginalized population to co-design, pilot, and evaluate an intervention. The final product is both an equity-focused NE-style grant application and a community accountability report. Ch. 913 Community-Based Participatory Research, CBPR. The methodological heart of community health doctorates, CBPR transforms students into genuine partners rather than extractive researchers. Collaborative research methodologies begin with deep history, postcolonial critiques, tribal sovereignty protocols, and Black feminist origins of CBPR, then move to practical tools, community advisory boards that hold real budgetary authority, memoranda of understanding co-drafted in plain language, and data sovereignty agreements. Community engagement strategies span the research cycle: asset mapping using appreciative inquiry, photo voice for agenda setting, community-owned data dashboards, and participatory ranking of research questions using Dotmocracy and nominal group technique online. Co-creation of knowledge is practiced relentlessly: joint interpretation sessions where community members are co-analysts, using live shared in vivo files, co-authored manuscripts with community-first authors, and alternative dissemination products, community comics, theater pieces, policy testimony. The entire course functions as a live CBPR project with a real partner organization. Students enter with a letter of commitment and exit with an IRB-approved protocol, pilot data, and community-governed dissemination plan. Ch. 914 Advanced Health Communication. In an era of misinformation and cultural diversity, effective communication is intervention. Health message development begins with advanced theory, elaboration likelihood model roots applied to vaccine hesitancy, narrative transportation theory for stigma reduction, and entertainment education frameworks. Students pre-test messages using online eye tracking and biometric arousal monitoring. Media and digital health strategies include social media listening dashboards, TikTok and Instagram Reels interventions co-created with youth, and WhatsApp chatbot campaigns for immigrant communities. We explore algorithmic bias and design countermeasures to prevent amplification of health inequities. Culturally tailored communication receives intensive treatment: community-led message design, transcreation rather than translation, and use of cultural archetypes and oral tradition structures. The capstone is a full-scale, theory-driven communication campaign launched with a partner organization, complete with process evaluation, dose-response analysis, and Community Handover Plan. CH 915 Advanced Health Behavior Change. Moving beyond individual-level theories, this course focuses on durable, context-sensitive change. Behavioral theories and models are critically examined. COMBI and Behavior Change Wheel for Intervention Mapping, Habit Formation Science, Tiny Habits, Implementation Intentions, and Identity-Based Change Models. We explore when and why traditional theories fail structurally oppressed populations. Intervention Design and Implementation uses intervention mapping steps 3 to 6 in depth, change objective matrices, theory-based methods, nudges, commitments, social norms, and adoption implementation planning with CFIR and EPIS frameworks. Sustainable behavior modification addresses maintenance and population-level shifts, policy and environmental supports, community ownership models, and relapse prevention at scale. The final project is a fully manualized, pilot-tested behavior change intervention with fidelity measures, cost estimates, and a 10-year sustainability roadmap. CH 916 Advanced Health Equity. The culminating Year 2 course challenges students to move from equity rhetoric to transformative praxis. Social justice frameworks ground the work: distributive, recognitional, and reparative justice, health capability approach, and decolonial theories of healing. Students learn to audit institutions for structural violence using the Health Equity Implementation Framework. Equity-focused policy development includes legislative drafting labs, equity impact assessments, and participatory budgeting simulations. We practice writing equity provisions into actual bills under consideration. Transformative approaches to health close the year: reparations-based health policy, community land trusts as health interventions, and abolitionist public health perspectives. The signature assignment is a transformative equity manifesto co-authored with community partners, accompanied by a feasible 5-year action plan and personal accountability contract for the student's own sphere of influence. By completing these 8-year 2 core courses, TBUGE USA doctoral candidates emerge not merely as highly skilled researchers, but as boundary-crossing scholar activists equipped to co-lead the next generation of equitable community health transformation. Year 3 core courses. CH 917 Advanced Community Assessment. Electives: Community Needs Assessment CH
Methods.
924 Advanced Public
Community
Health Leadership.
Profiling.
Leadership
Stakeholder
Theories and
Engagement
Frameworks.
Techniques.
Organizational
CH
Management.
918 Advanced
Strategic
Health Program
Decision
Planning.
Making. Strategic
CH
Planning Frameworks.
925 Advanced
Program
Health
Design
Systems
and
Management.
Implementation.
Healthcare
Logic
Operations.
Model Development. Quality Improvement.
CH 923
Systems
Advanced
Integration.
Research Methodology.
CH
Mixed
930
Methods
Advanced
Research.
Aging and Public Health.
Advanced Experimental
Geriatric
Designs.
Health Issues.
Research Ethics and
Age-friendly
Integrity.
communities. CH
Long-term care
919
systems.
Advanced Health Informatics.
CH 926
Health
Advanced
Systems.
Cultural Competency.
Data Analytics and
Cross-cultural
Visualization.
communication.
Digital
Health
Equity
Equity
Frameworks.
Frameworks.
Culturally
CH
Responsive
920
Care.
Advanced Grant Writing.
CH
927
Funding
Advanced
Opportunity
Disaster
Identification.
Preparedness.
Proposal
Emergency
Development
Response
Strategies.
Planning.
Budget
Risk
Planning
Assessment.
and Justification.
Community Resilience.
CH
921
CH
Advanced Policy
931
Advocacy.
Advanced Community Health
Policy
Economics.
Analysis and Development.
Economic Evaluation
Advocacy
Methods.
Strategies and Tactics.
Cost-Benefit Analysis.
Legislative Process
Resource
Navigation.
Allocation Strategies.
CH
922 Advanced Health
928
Education.
Advanced Occupational Health.
Curriculum Development.
Workplace Health Promotion.
Teaching Methodologies.
Occupational Disease
Learning
Prevention.
Assessment Techniques.
Workplace Safety
CH
Standards. 923
CH
Advanced
929
Research. Advanced Maternal
Methodology.
and Child Health. Mixed Methods
Reproductive
Research.
Health Services.
Advanced Experimental
Development
Designs.
Programs.
Research
Family
Ethics
Centered
and
Care.
Integrity.
CH
930
900
Advanced
and
Aging
Aging
and Public
Dissertation.
Health. Independent
Geriatric
Research
Health
Project.
Issues.
Original
Age-friendly
Contribution
communities.
to Knowledge. Long-term
Capstone
care
experience
systems.
of doctoral program.
CH
Year 3 core
931
courses.
Advanced Community Health Economics.
TBUGE USA
Economic
Doctoral Program
Evaluation
in
Methods.
Community Health. Cost-benefit
Year 3
analysis
is the crucible, where everything
resource
previously
allocation
learned
strategies
is forged into independent
choosing
scholarship
your electives
and transformative leadership.
Select electives aligned
This
with your
final year
research
shifts from
interests.
intensive coursework to applied
Consult
synthesis,
with your academic
professional
advisor for
mastery,
guidance,
and the production
Consider
of original
electives
knowledge
that complement
will shape
your
community
career
health
goals.
practice for decades.
Complete a minimum of
Every
2
course
electives
is
during
designed
the
as a bridge to
program.
post-graduation
Electives. Students leave
not
TBUG
only with a doctorate,
USA,
but
doctoral
with funded
program
grants,
in community
published
health,
papers, active
electives
policy
in the
influence,
TBUG
and
USA
community
partnerships
health
that are already
doctoral
generating
program
change
are not filler courses.
CH
They are high-level,
917
doctoral-only
advanced community
specializations
assessment
that allow students to carve out
advanced
distinctive
community assessment
expertise
transforms
and build
students
nationally
from
recognized
consumers of secondary
portfolios in
data
focused
into
domains.
architects of primary. Each elective
Community
is a
owned
rigorous
intelligence.
4-credit, 10-week
Community
intensive delivered
needs
through the same
assessment
advanced
methods move
online
far
platform
beyond standard
as core
surveys.
courses, featuring
Students
live expert
master
panels,
rapid ethnographic
real-time
assessment
field
procedures,
procedures,
REAP,
and
deliverables
participatory
designed for
geographic
immediate
information
professional
systems,
impact.
PGIS. Students
where
must
residents
complete a minimum
draw their
of
own
2
health
electives
maps on tablet
though
devices.
many choose 3 or 4
Community
to position
readiness
themselves
cells that score
as
stages
leading
of change for
authorities in their
specific
chosen
issues,
niche,
and photo voice protocols that culminate in public exhibitions
public
and policy
health leadership.
demands.
This
An
elective
entire
transforms
module
is
is
devoted
devoted
to
to
decolonized
into visionary
assessment,
leaders
rejecting
who can
deficit
direct
framing
departments
and centering
national
indigenous
initiatives
and black
and
ways
global
of knowing
consulship.
health. Leadership
Data-driven
theories and
community
frameworks
profiling
begin
reaches
with a
doctoral
critical
depth.
examination of
Students
traditional
integrate
models, a
census,
transformational,
electronic health
servant,
records,
adaptive,
syndromic
and then move
surveillance,
to emerging frameworks
social media
specifically
sentiment,
designed for
and
public health
crowdsourced
crises,
symptom apps into dynamic,
trauma-informed leadership,
real-time community health
abolitionist
dashboards
leadership
built in Tableau
and regenerative
or Power BI
leadership that heals systems
They
rather
learn
than
small
merely
area
managing them.
estimation techniques
When
when direct
complete
data are sparse
360
and conduct
degree
health
leadership
equity
assessments
impact
with
forecasts
their actual
for
workplace
proposed
teams,
developments
and
new
receive
highways,
executive coaching from
gentrification
faculty
projects,
who have
prison
served as
expansions,
state health officers.
stakeholder
and WHO
engagement
advisors
techniques
are practiced, not just
Organizational
studied.
management training is
Students
brutally
facilitate
practical.
virtual community
Students
congresses
take over
using
real
mural and
organizational
Mentimeter,
turnarounds during
create
the term,
stakeholder
failing
power
community
interest
clinics
grids
that actually
struggling
determine
research
coalitions,
governance,
underperforming
and
health
negotiate data
departments,
trust agreements,
and
where
implement
communities
evidence-based
retain veto
restructuring
power
using
over
change
publication.
model, Baldrige performance
The capstone
excellence
is a full
criteria,
community health
and equity
assessment
center
co-owned
design
with a partner community.
They manage actual
complete
budgets,
with executive summary
negotiate
in plain
union
language,
contracts via
technical
simulation,
report,
and lead
interactive
crisis
online
communications
dashboard
during live
and a
disaster
community-controlled
drills.
data repository.
Strategic decision
Many of
making
these
under
assessments
uncertainty
immediately
dominates
become
the
the
final
official
weeks.
foundation for local health
Students
improvement
use scenario
plans.
planning to prepare health
CH
systems for climate
918
migration,
advanced health
artificial
program
intelligence
planning.
disruption,
Here,
and political
students
regime
learn to
change.
convert assessment findings
The
into
capstone
funded,
is a 5-year
scalable,
strategic
equitable
plan
program
for an existing
that
public health entity that is
Strategic
presented
planning
to its Real
frameworks
board of
begin with
directors.
theory of change workshops
Many
that
plans
span
are
years,
adopted
not
outright,
months,
and several graduates
Students
are hired
master
into the
VMOSA,
C-suite
vision,
positions
mission,
their plans created.
objectives, strategies,
CH,
action plans,
925
results-based
advanced
accountability,
health systems
and collective
management.
impact.
Then
For
critically
those who will
interrogate
run the
when these
complex
frameworks
organizations
have harmed
that deliver
marginalized
community
communities
health
and how to adapt them.
Healthcare operations
Program
mastery
design
and
includes lean
implementation
healthcare,
occurs through
Six
live,
Sigma Black Belt
real-time
training
planning
adapted
with
for
actual
safety net
community
settings,
organizations,
and theory of constraints applied
Students
to
use
community
intervention
health
mappings
settings, final
with
steps
perpetual
to
waiting
produce
lists.
detailed protocols,
Students
performance
redesign
objectives,
actual patient
determinants
flows
matrices,
using value stream
theory-based
mapping,
change
and implement
methods,
changes
and
that are
practical
measured in real
applications.
time.
Every
Quality
program
improvement
must
reaches the doctoral
explicitly
level.
demonstrate how it
Students
disrupts
lead rapid
structural
cycle
drivers of
PDSA
poor
projects
health,
that
not
eliminate
merely
racial
behavioral
disparities
ones.
in surgical outcomes.
Logic model development
Reduce
reaches
emergency
advanced
department
levels.
boarding for behavioral
Students
health
create
patients
enhanced
and
logic
achieve
models
100%
with equity
same-day
indicators,
access
feedback
in rural
loops,
clinics,
and contingency
They
branches.
become certified in advanced
They build
improvement
program
methods,
theories strong enough
IHI
to withstand
advanced training
hostile
program
political
equivalent.
environments. Systems
The signature
integration
assignment
focuses
is a
on
complete,
merging fragmented
ready-to-implement
services.
program plan
Students
for a community
architect
partner,
statewide
including
learning health
Gantt
systems,
charts,
design
fidelity
monitoring
monitoring
communities
tools,
of health
adaptation
that actually share
guidelines
savings,
for cultural and contextual
and build
variation,
interoperable data ecosystems
and a 10-year
across
sustainability
jails,
roadmap
schools, and
that does
hospitals.
not depend on perpetual
The
grant
final
funding.
deliverable is a published health system
919
redesign
advanced
that has already
health
been
informatics.
implemented by the partner
In
organization.
an increasingly digital world,
CH
community health leaders
926
must
advanced
command
cultural
information
competency,
systems rather than be
far
controlled
beyond
by them.
sensitivity training.
Health
This
information
elective
systems
produces
training
scholars who
includes
can
mastery
dismantle
of
culturally
FHIR
destructive
standards
systems
and
open
build
healing
EHR
centered alternatives,
and community-owned data cooperatives
cross-cultural
that give
communication
residents
control
training
over their
virtual
own
reality
records,
simulations, where
students
students learn
navigate
to audit
real-time
electronic health
interpretation
record systems
with live
for algorithmic bias, and design culturally rooted scores that reduce, rather than reinforce, family meetings across 6 languages simultaneously. Data analytics and visualization health equity frameworks are taught at the theoretical cutting edge. Students build machine learning models theory that forecast community health race crises, post-colonial overdoses, disability-related deaths, using integrated social needs data to health services, then overlay intervention triggers. They conduct institutional cultural audits that have forced major hospitals to change policies that display only actionable information in culturally resonant incarcerated women, and language digital access. Health innovations form the cutting
Culturally
edge.
responsive
Students
care
pilot chatbots in multiple languages
with traditional
healers,
undocumented
indigenous medicine people, design VR exposure therapy for community trauma, and imam-led mental
and
health
develop
programs,
blockchain-verified community
resulting
health
in co-developed
payment
integrative that eliminate exploitation. The dissertation
The
level
final
project is either a new model of culturally grounded
working health
care
informatics
that is innovation deployed
or
with a community
decolonized
replacement
partner,
for an
or
existing
B,
harmful
a
practice.
published
System level critique that leads to actual policy change in data governance. Disaster preparedness. CH prepares leaders who will be called when everything fails. This course turns
Emergency
scholars
response
into
planning
funded
beyond
investigators. Tabletop exercises.
Funding opportunity
Students write the
identification
actual
begins
all
with
hazards
sophisticated
plan
searching
searching
of
of federal
federal
tribes.
CDC,
Then activate portions
HISA,
during real events,
PCORI,
wildfires,
Foundation,
floods,
and state
mass
opportunities.
shootings. But also
master
teaches
incident
students
command
how to create
system
funding
at the
when
Type
none
2
exists,
level,
and serve in
legislative-directed
real emergency
appropriations,
operations
community
centers.
benefits dollars from non-profit
Risk
hospitals,
assessment includes
and
participatory grant making where residents decide priorities, novel pandemics, proposal development
and infrastructure
strategies
collapse
are taught by
cascades.
faculty who have
Students
collectively
perform
secured
threat hazard
over $200 million
using
in
Los
funding.
Alamos National
Every
Laboratory
section of a
models
NEA 01
and create vulnerability
specific
indices
aims through
weighted
human
by
historical
subjects,
disinvestment
rigor,
and reproducibility. Community resilience is dissected
the
and
ultimate
rewritten
goal.
in live workshops. Students establish resilience hubs in Students learn to churches write and for multiple
laundromats,
mechanisms
train
simultaneously.
community
Emergency response
awards
teams
are
led by
03
grandmothers and
are
formerly
21
incarcerated fire
PCORI
captains.
pragmatic
trials
and design
foundation
cash
concept
concept
patents
systems
that activate automatically
Budget
when
planning
disaster
and
strikes.
justification
Receives
Several
merciless
graduates
attention.
have led the
Students
COVID-19
build modular budgets,
hurricane,
negotiate
and
indirect
responses
rates for entire
master
states,
effort reporting,
and write
justifications
928
that survive the
advanced
most
occupational
skeptical
health.
reviews.
For
The
scholars
course
who will
culminates
protect
in the
the health
submission
of
of
a
working
real
people
grant and end
most students
exploitative
submit
labor
an
practices.
actual
application during the term. Workplace health promotion
The
moves
historic
beyond
success
step
rate
challenges
for this
to living
course
wage
exceeds
campaigns,
65%
union co-management
management
of
of
safety
submissions,
committees, and worker-owned CH
cooperatives
921
that
advanced
prioritize
health
policy
over profit.
advocacy.
Occupational
Students
disease
graduate
prevention
able to
includes
move
cutting-edge
legislation
exposure science
and hold power accountable.
Students deploy personal sensors Policy in nail analysis salons and development
meatpacking
includes advanced
plants
regulatory
and
science.
gig warehouses,
Writing
then
comments
use the data
on federal
to force
regulatory
notices
change
that
actually change rules.
They
Performing
master
regulatory
compensation
impact
systems
analyses
and become expert
and
witnesses
drafting
in
model
workers'
bills using real
compensation
legislative
courts.
council templates. Workplace safety standards
Advocacy
are
strategies
rewritten,
and tactics
students
range
draft
from
new
insider
OSHA
negotiations
regulations to disruptive
lead
protest.
ISO 45001
Students master coalition
certifications
tables
for community-based
media training,
organizations,
writing op-eds that get
and
published,
shut down
television
dangerous
employers through
TikTok
strategic
testimony,
enforcement campaigns,
and direct action planning that centers
the final
affected
project
communities.
is either a new occupational health
participate
standard
in live
that is adopted
legislative
or the
sessions
successful
via Zoom,
defense of workers
delivering
who blew
testimony
the whistle that has influenced actual
CH
bills. 929
Legislative
Advanced
process
Maternal
navigation
and child
covers
health
both federal and state levels.
produces the nation's
Students
leading
track
experts
bills
on
in real
birthing
time
justice
using quorum
and child
Legiscan,
flourishing. Build sponsor packets, reproductive health
negotiate
services
amendments,
training includes
and
full
celebrate
spectrum doulas
or mourn
community
final votes.
birth workers. The
An
capstone
abortion
is
funds
leading a
as
successful
legitimate
policy
parts
change
of the health system.
Many students see their
Students
advocated
staff
provisions
underground
signed
abortion
into law
networks
before graduation
and design legal defense funds
CH
that have kept providers out of
922
prison.
advanced health education.
Child development programs
Graduates
are
will teach
reimagined
the next
through a racial
generation,
justice lens,
so they must master
Students create
transformative
liberation-focused
early childhood
curriculum
programs
development
that teach
moves
children
beyond
beyond learning
histories,
objectives
languages,
to liberation-focused
and power.
design. They
Students
end
create
zero-tolerance
syllabi
preschool
that center
discipline
community
and
voices.
replace it with
Replace
restorative
traditional
circles.
textbooks with community
Family-centered
materials.
care means centering
and design
incarcerated
courses
mothers
that award
migrant
credit for lived
families
experience
and chosen family structures.
Teaching methodologies span the
Students
spectrum.
establish
Flipped
prison
classrooms
nurseries
that
using
work,
community-generated
reunify
videos,
families separated
problem-based
by
learning
deportation,
rooted in local
and
health
landmark
crises,
court cases
popular
establishing
education
children's
circles,
right to their parents,
and virtual reality
many
simulations
graduates
of structural
become the national
incompetence.
experts testifying
Students
before Congress
facilitate
on
actual
paid
classes.
family leave and
Some teach
universal
sections
child
of
care.
TBUG USA's
CH
Master's
930
Program under
Advanced
mentorship,
Aging and Public Health.
learning assessment techniques
Redefines
reject
what it
multiple
means to
choice
age
hegemony
with dignity and
Students
power in
design
communities.
performance assessments.
Community
Geriatric health
impact
issues are
portfolios
addressed through a
and
disability
reflective
justice
praxis
and
journals
racial
graded
equity
through
lens.
critical friendship protocols.
Students end the overmedication
The final
of Black
product
elders
is a complete course,
establish dementia
or
villages
training institute
governed by residents
that is immediately
and
launched
create
with a
reparative
community
memory care
or
programs for
university
survivors
partner.
of Jim Crow violence. CH
Age-friendly
923
communities
advanced
are built from the
research
ground up.
methodology. Students work with grandmother methodology to take over abandoned schools and turn them into intergenerational hubs that provide housing, mixed methods, research reaches full maturity, and dying with dignity services design under one and defend convergent, long-term care systems are dismantled and replaced. Sequential. Students and design greenhouse models that genuinely by the direct community epistemologies, end nursing home profiteering through public ownership campaigns, meta-inferences, and establish community strategies for mixed that guarantee elders can age in place. Advanced experimental several projects include have already ended nursing home randomization entirely in their counties. Step-wedge implementation trials. Smart 931 multiple assignment randomized health trials. Economics. For adaptive interventions, the economists who prove that randomized is the best for just-in-time behavioral economic evaluation methods reach the frontier. Research students ethics and integrity go beyond human subjects protect values reducing inequalities. Conduct distributional cost-effectiveness analysis weighted by lifetime disadvantage, data repatriation schedules, and use social welfare and functions that prioritize for when partnerships must end honorably. Cost-benefit analysis is weaponized for culminates in the successful defense of the dissertation freedom from incarceration, including full methodological justification, power calculations, a year lived in one's ancestral language, and dissemination plan. And prove that reparations 900 are the most cost-effective health intervention in American history. The pinnacle of the TBUG resource allocation strategies include participatory budgeting where residents decide how Medicaid dollars are spent to knowledge, community benefits negotiations that extract hundreds of millions from non-profit hospitals. Students work under a committee of and sovereign wealth funds for indigenous at least health. One community co-mentor. Graduates become the economists that foundations and the dissertation may take traditional when they finally want to invest in actual health. But every project must meet choosing your elective criteria. Select electives aligned with your original contribution that extends your dissertation method is not separate or from these courses. In community health. Most students use their electives direct as the measurable benefit to a theoretical community of their dissertation, not merely implications for. Choose the domains where you intend to establish lifelong expertise at minimum. And leadership. One first author consult paper with your academic advisor for guidance. 4. Every student is plan that continues after defense and a community mentor. Students together help craft an elective pathway that positions receive you for continuous jobs, peer, grants, and faculty review and through weekly online writing labs. Consider final defenses that complement your career goals. Sessions attended by community partners, state health department, policymakers, take leadership and international systems management. Many dissertations result in new incarceration's impact on health, resident-owned data disaster preparedness, ongoing intervention and child health. Or policy centers. If you want to run for office, the defense is not an advocacy, but a launch with leadership graduates and community health economics. A funded continuation plan of 2 electives and an established reputation as most scholars who keep their promises to communities because they become the foundation of their post-graduation identities and the dissertation. Many graduates are known nationally graduates do not the merely earn a doctorate. Who wrote the book on culturally responsive disaster response who can simultaneously publish in the most rigorous journals that reparations save money. Secure 8-figure grants. These electives do not merely round out your training for coffee on the block. They define the specific kind of ancestor you will become in community health at its most powerful. Choose deliberately. Year 3 core courses. The communities you will serve are waiting. 917 Advanced Community Assessment. Program support and community resources. Needs assessment methods. Academic support. Data-driven community writing profiling. Center for dissertation. Stakeholder engagement tutoring techniques. Services. CH. Research methodology advanced workshops. Health program planning. Peer study groups. Strategic planning online frameworks. Learning resource. Program design research and implementation. Funded logic research model development. Community health projects, 923 advanced research international research collaborations, mixed methods research, publication support, advanced experimental conference designs, travel grants, research faculty mentorship and integrity, one-on-one advising, 919 research health informatics, career guidance, health information systems, networking opportunities, data analytics and visualization, professional development, digital health program innovation support and resources, CH. 920 Advanced Grant Writing Doctoral Program in Community Funding Health Opportunity Identification at TBUG USA Proposal Development We do not strategies. Treat doctoral education budget as an individual and justification contest. We treat it as a collectively resourced, advanced policy advocacy journey where every student policy is intentionally and development to become a field-shaping scholar advocacy leader. Strategies and tactics. From the moment of admission, legislative process in a comprehensive ecosystem of academic, research, 922 financial, health education, and human support that is unparalleled curriculum development, online doctoral programs, teaching methodologies. This is not student learning services. Assessment techniques. This is the infrastructure of transformation. 923 advanced research. Academic support at methodology USA is built on the conviction that brilliance is universal. Advanced experimental but access to elite-level scaffolding is not. Research ethics and integrity. We remove every preventable barrier between you and your doctorate. 970 dissertation. The Writing Center for Dissertation is not a general tutoring service. It is a doctoral contribution to knowledge. Dissertation specialized writing institute staffed by published methodologists, former journal editors, core courses, and community-engaged writers who have guided over 400 public health dissertations to completion. Year 3 is the crucible book where everything previously learned or 90-minute appointments into independent scholarship and transformative leadership from prospectus to final defense. This final year shifts from intensive coursework to developmental editing, professional surgery when needed, and the production of original knowledge that will shape community health practice for decades. The center also runs designed as a bridge to post-graduation qualitative findings chapter intensives leave not only with quantitative results sections that get cited, policy implications that actually change laws, and community partnerships that are already generating convention and still get approved. Ch. 917 advanced community assessment are available 24/7 advanced community through dedicated PhD level biostatisticians from consumers of secondary data scientists into architects who staff live drop-in rooms community-owned and scheduled deep dive sessions. Community needs assessment whether you are debugging a multi-level standard survey at 2 a.m. Students master rapid ethnographic maximum likelihood estimation, participatory geographic information systems, or needing to build a Bayesian hierarchical where residents draw their own health maps on tablet devices. An expert is waiting. Community readiness models all sessions are recorded with commission-specific issues, so you can re-watch your and own photo voice protocols that culminate in public methodology workshops and policy run year-round in intensive weekend an entire and week-long format is devoted to decolonized assessment, in vivo for team-based qualitative analysis and centering indigenous for reproducible and black ways of knowing health. Deduce for mixed methods data-driven community profiling based participatory research bootcamp with real community partners, electronic health retreats that end with submitted applications, social media sentiment, dissertation proposal and crowdsourced symptom apps where students arrive with a real-time community health dashboards built in Tableau or Power BI. And a timeline. They learn small area estimation techniques are intentionally when cultivated, are sparse, not left and to conduct chance. Health equity impact forecasts. Upon admission, for proposed development placed into small new highways, faculty facilitated accountability pods prison organized by methodology, topic, stakeholder and engagement techniques are practiced. These pods meet weekly for the entire program. Students facilitate becoming writing community congresses, using mural job Mentimeter allies, create stakeholder power interest grids. Many actually determine research after graduation. And negotiate online data learning resources include always retain veto power over with negotiated licenses to the every major public health journal, health assessment, and open science repository where students complete with executive summary in plain language and community technical reports for citation credit, interactive online and a growing digital archive and of recorded guest lectures from MacArthur Fellows. CDC many of these assessments immediately become the official foundation for local health improvement plans. Research opportunities. Ch. 9H is not something you wait to do after coursework. Here, at TBUG students learn to convert assessment findings into financial, intellectual, equitable community lives that endure. Strategic planning frameworks are guaranteed theory of change workshops that span years, not months. These are not teaching assistantships. Students master they are real, visible positions on faculty grants, strategies, community contracts, action plans, CDC evaluation accountability, and international consortia. Then critically interrogate students earn $25,000 to $45,000 per year and how to adapt while building their CV, program design and implementation national presentations, real-time and relationships that last community organizations. Community health students projects use intervention simulations, final steps to produce detailed network of over 300 formal partnerships, determinants matrices, theory-based change methods, tribal nations, and practical applications. Immigrant mutual aid societies. Every program formerly incarcerated-led organizations how it disrupts structural drivers in life projects that need their exact behavioral ones. Past logic model development reaches advanced equity operations in public housing, enhanced designed cash models with equity indicators, with guaranteed income pilots and contingency and co-created youth-led mental health courts. They build programs that reduce theories strong enough by 80% to withstand hostile political international research collaborations are built in. The signature assignment current is a partnership span ready to implement Kenya, program plan Guatemala, for a community the Philippines, including First Nations Canada. Fidelity monitoring tools. Students join adaptation guidelines for cultural and contextual variation. Traditional birth worker integration. And a 10-year sustainability roadmap that does not depend on perpetual grant funding. With all expenses paid and community-determined salaries. 919 Advanced Health Informatics. Publication support is institutional, in an increasingly digital world. Community
Office
health
of
leaders
Scholarly
must
Communication
command
assigns
information
every
systems
student a
rather than be
publication
controlled
mentor
by them, who shepherds at least
Health
3
information
peer-reviewed
systems
articles
training
to
includes
acceptance
mastery
during the
of
program.
FHIR standards.
We cover
Open
open
access
EHR
fees
and
provide
community-owned
statistical
data
review before
cooperatives
submission
that give residents
and run
control
mock study
over their
sections
own records
that are more brutal than NE, so the real
Students
one
learn
feels
to
easy.
audit electronic health records,
Conference
travel
systems for
grants
algorithmic
are unlimited
bias
for
and
accepted
design
presentations.
presentations risk scores that reduce.
We do not cap
rather
dollars,
than reinforce.
we cap excuses.
Disparities.
Students
Data
present at
analytics
APHA,
and visualization moves
Society
into
for
prevention
Predictive and
research,
Prescriptive Analytics,
International Conference
Students
on Community
build
Machine
health
Learning Models
and
that
movement
forecast
gatherings
community
like the
health
People's
crises.
Health Assembly.
Opioid
Many
overdoses,
return with job
heat-related
offers
deaths,
and new community
using
partners.
integrated social needs data.
Faculty
Then
mentorship.
overlay intervention triggers.
Our faculty do
They
not merely
create
teach
executive
courses,
dashboards
they
for
adopt
community
you into
health
their
workers
lineage that display only
one-on-one
actionable
advising
information
begins
in
before
culturally
enrollment
resonant
and
formats.
never ends. Digital
Every
health
student
innovations
has a
form the
primary
cutting
faculty
edge.
advisor
Students
plus a
pilot
community
chat
co-advisor
bots in multiple
with
languages
equal
that
decision-making
connect
power.
undocumented residents to care.
Meetings are monthly
Designed
at minimum,
via exposure
weekly
therapy
when
for
writing.
community trauma.
Advisors
And
read
develop
every
blockchain
draft the
verified
same week it
community
is
health
sent,
worker
no
payment
exceptions,
systems that eliminate
and respond
exploitation.
with the care they would give
The
their
final
own
project
child's
is
work.
either A.
Research
A working
mentorship
health
is apprenticeship,
informatics innovation
not
deployed
supervision.
with a community partner.
Students are
Or
brought
B.
onto grants
A
as
published
co-investigators,
system-level critique
not
that leads
assistants.
to actual policy change
They
in
co-design
data
studies,
governance. Co-lead community engagement.
CH,
Co-write
920
papers,
advanced grant
and are
writing.
first author when they do
This
the most
course
work
turns
and
scholars into
co-present funded
funders.
investigators.
Faculty share
Funding
their networks
opportunity
the way elders
identification
share
begins
medicine.
with sophisticated searching
Career
of federal
guidance
needs,
is strategic
CDC,
and continuous.
HISA,
From
PCORI
year one,
Foundation,
students
and
build
state
individualized
opportunities,
development plans
but also
that are
teaches
updated
every
every
semester
semester
with
with
funding
mock job
when none
talks,
exists,
negotiation
legislative-directed
coaching,
appropriations,
and introductions
community
to search
benefits
committee
dollars from
chairs.
non-profit hospitals,
We
and
track
participatory
every positioning
grant-making where
community
residents
health
decide
academia,
priorities,
government,
and
proposal
movement
development
organizations
strategies
and match
are
students
taught by
before
faculty
postings go
who
public.
have collectively secured
Networking
over $200
opportunities
million
are
in
engineered.
funding.
Monthly kitchen
Every
table
section of a
sessions
NEA
where legendary
01,
figures,
specific
former
aims
surgeons
through
general,
human subjects,
MacArthur geniuses,
rigor,
and
tribal
reproducibility, prison
is dissected
abolitionists,
and rewritten in
cook
live
dinner
workshops.
on screen and take every question.
Students
Closed
learn
door
to write
sessions
for
with
multiple
foundation program
mechanisms
officers
simultaneously,
who reveal what they
K
actually
awards,
fund.
and the
Our
annual
03
Community Health Power
Summit,
21,
where students
PCORI
present
pragmatic
lightning
trials
talks to
and
500
500
concept
movement
leaders who are hiring.
Budget planning
Professional
and
development
justification
funding
receives
is merciless
$5,000
attention
per year.
Students
No
build
questions
modular
asked.
budgets.
For
Negotiate
everything from
indirect
statistical
rates,
software
master
to doula
effort
training
reporting,
to legislative
and
advocacy
write
fellowships
justifications
on Capitol
that
Hill.
survive the most skeptical
We
reviews.
fund the training that makes you
The
dangerous
course
to the
culminates
status
in the
quo.
submission of a real grant.
This is not
Most
support.
students submit an actual
This is
application
investment.
during the term.
TBUG
The historic
USA
success
does
rate
not
for
produce
this course
graduates.
exceeds 65%.
We produce the
funded
next
on
generation of
first submission,
ancestors
who will be cited,
CH,
quoted,
921
and followed for the
advanced
rest
policy
of the century.
advocacy.
Every resource
Students
listed
graduates
here exists
able
for
to
one
move
reason,
legislation
to make
and
certain
hold
that
power
when you
accountable.
speak, systems listen,
Policy analysis
communities
and
thrive,
development
and
includes
history
advanced
remembers your
regulatory
name.
science.
Writing comments on federal
Next
register
steps.
notices that actually change
Application
rules,
process.
performing regulatory
Submit
impact analyses,
online
application, and drafting model bills
Provide
using real
academic
legislative
transcripts.
council templates.
Submit research
Advocacy
statement.
strategies and tactics
Include
range from
free
insider
references.
negotiation to disruptive
Application
protest.
deadline.
None. Students master
Contact
coalition
tables.
information, media training,
Program
writing
director.
op-eds that get
Heat
published,
science depth.
television interviews,
Email.
TikTok testimony,
info@buglobalextensionusa.com.
and direct action planning that centers affected communities.
Phone.
+1. They
646
participate in live
409
legislative sessions via Zoom,
4299.
delivering testimony that has influenced actual bills.
www.buglobalextensionusa.com.
Legislative process navigation
Next
covers
steps.
both federal and state levels.
As we draw near the conclusion
Students
of
track
this bills
comprehensive
in real
exploration
time using
of the
Quorum and
TBUG
LegiScan
USA
build sponsor
Doctoral
packets
program in
negotiate
community health,
amendments
and
It's
celebrate
essential to pause
or mourn
and
reflect
reflect
on the
votes.
profound journey that
The
awaits those who
capstone
choose
is
to
leading a
embark on
successful
policy change.
This online
Many
doctoral
students
program
see their advocated
housed within
provisions
the innovative
signed into
framework
law
of
before
Triune
graduation.
Biblical
University Global
CH,
Extension,
922
USA
Advanced Health
a
Education.
pioneering institution committed to
Graduates
blending
will teach
rigorous
the next
academic
generation
inquiry with
so they
ethical,
must master
community-centered
transformative
action.
pedagogy.
Represents more than a
Curriculum
degree.
development
It embodies
moves
a
beyond
calling to
learning
transform
objectives
lives
to
and
liberation
systems through the
focused
lens
design.
of public health equity.
Students create syllabi
Founded
that
on
center
principles
community
of
voices,
accessibility,
replace
excellence,
traditional textbooks
and unwavering
with
support
community-authored
for working
materials,
professionals worldwide,
and design
courses that
TBUG
award credit
USA
for lived
has
experience.
redefined
Doctoral education
Teaching
by making
methodologies
it fully
span
on
the
the
spectrum,
spectrum, inclusive,
flipped classrooms
and deeply
using
rooted in real-world
computer-generated videos, problem-based learning rooted in local health crises, by visionary popular educator Reverend Professor Daniel and virtual reality simulations of structural has grown into a global beacon, Students
Serving
facilitate
thousands of
actual
scholars
classes
from diverse
Some
backgrounds,
teach sections of
all united by a
TBUG
shared
USA's
passion for
Master's
advancing
Program
health
under
outcomes in
mentorship.
underserved communities.
Learning assessment techniques
Imagine
reject
yourself,
multiple-choice
perhaps
hegemony.
a seasoned public health
Students
practitioner
design
in a
performance
bustling urban
assessments,
clinic,
community
a
impact
policy advocate
portfolios,
navigating the corridors
and
of
reflective
state
praxis
government,
journals graded
or a
through
community
critical friendship
organizer bridging
protocols.
gaps in rural health access.
The final product is a
now
complete
poised to
course
elevate your impact
or
through this
training
doctoral
institute
pursuit.
that is immediately
The
launched
program
with a
is not
community
merely an
or
academic
university
credential.
partner.
It's a strategic
CH
investment in your capacity to lead,
923
innovate,
advanced research
and heal on a
methodology
scale that ripples across
This
neighborhoods,
capstone
nations,
methodology
and
course
generations.
integrates everything for dissertation
With no rigid
excellence.
application deadlines,
Mixed methods
TBUG
research reaches
USA
full
welcomes
maturity
you at the moment of
Students
your readiness,
design and defend
ensuring that your
convergent,
transition into this
explanatory
scholarly
sequential,
community is
exploratory
seamless and
sequential,
affirming.
and multi-phase
In the pages
designs
that
follow,
genuinely
we
privilege
will unpack
community
the straightforward
epistemologies,
yet meaningful steps to
They
join
master
us,
joint displays,
demystify the application
meta-information
process,
and publication
with practical
strategies
guidance
drawn
mixed
from the
methods
successes of
journals.
our alumni,
Advanced
and provide
experimental
direct
designs
avenues to
include
connect with the
community
dedicated
partnered
team
cluster
behind the
randomization.
program. Stepped wedge
This is your
implementation
invitation to
trials,
step forward,
smart,
not as a
sequential
solitary
multiple
applicant,
assignment randomized
but as a vital
trials
addition to a
for
network of
adaptive
change
interventions,
makers who are
and
already
micro-randomized
reshaping the
trials for
landscape of
just-in-time
community
behavioral
health.
interventions delivered
The
via
beauty of
smartphone.
TBUGE USA
Research
lies
ethics
in its
and integrity
ethos of
go beyond
openness
human
and
subjects
empowerment.
protection to
As
research
an
justice.
evangelical,
Interdenominational
create community
institution,
IRB
we infuse
equivalents,
every aspect
negotiate
of the
data
program with
repatriation
values of
schedules,
compassion, justice,
and right
and
dissolution
stewardship
clauses for when
drawn from
partnerships must
Judeo-Christian
end
principles
honorably.
to inform our approach
The
to
course
health
culminates
disparities,
in the successful
ethical
defense
defense of the dissertation
and holistic
proposal,
well-being,
including full
Yet,
methodological
our
justification,
curriculum remains
power
rigorously
calculations
secular
in its
community
scientific benefit
foundation,
agreement,
welcoming
and dissemination
scholars of all
plan,
faiths and none,
united by a commitment to
970
evidence-based practice
dissertation,
and cultural humility.
The pinnacle of the TBUG
Picture the virtual
USA
classrooms
doctoral
alive
journey
with
is
discussions
an
on
independent
advanced
research
epidemiology
project that
applied
makes
to
an
faith-based
original
contribution
contribution
to knowledge and
or
to community
dissertation
life,
defenses,
where students
from day
unveil
one of year
interventions
3,
that integrate
students
spiritual
work
care
under a committee
with
of
clinical
3
faculty
faculty
plus at least one
This
community
fusion creates
co-mentor
graduates
with
who are
decision-making
not only
authority.
technically proficient,
The
but
dissertation
profoundly
may take
empathetic
traditional
leaders,
or manuscript
capable
format,
of addressing the
but
soul
every
deep
project
dimensions
must
of
meet
public
4
health
non-negotiable
challenges.
criteria. As you prepare
1.
to take these
Original
next steps,
contribution that
consider the
extends theory,
testimonials of our
methods,
alumni
or practice
Dr.
in community
Maria
health.
Gonzalez, who leveraged her doctorate
direct,
to establish
measurable
a bilingual
benefit to a
community
partner
health
community,
center in Texas border
not merely
towns,
implications
reducing
for
maternal mortality by
3.
40% through
Publication
culturally tailored
trajectory,
programs.
at minimum,
Or
1
Dr.
first
Jamal
author
Washington,
paper, accepted
whose
or
research on
impress.
urban food deserts informed
4.
national
Sustainability
policy,
plan
securing
that
federal
continues
funding
after
for
defense.
community gardens nationwide.
Students defend proposals
These
early
stories
in
are
year
not
3,
anomalies.
receive
They are the
continuous
norm
peer
for TBUG
and faculty
review
review
through
graduates
weekly online writing
who emerge
labs
equipped with the tools
and present final
networks,
defenses in
and
public
confidence
virtual
to turn
sessions
vision
attended
into
by
verifiable
community partners,
impact.
policymakers,
With rolling admissions,
and international
there
colleagues.
is no pressure of cutoffs.
Many
Just
dissertations
the gentle
result in
urgency
new
of your own
community
aspirations
institutions calling you
resident-owned
forward.
data trusts.
Let us now
ongoing
delve into the
intervention
application
programs,
process or policy
a
centers.
gateway designed with intention
The defense
to honor
is
your
not an
experiences,
endpoint,
but a launch.
and illuminate your
Graduates
potential.
walk away with their degree.
Application
A
process,
funded continuation plan,
the application
and an
process
established
for
reputation
the TBUG
as scholars who keep their
USA
promises
doctoral
to
program
communities.
in community health is
By
crafted
completing
with the
these
utmost
year 3 core
respect for the
courses and the
complexities of
dissertation,
adult learners'
TBUG
lives.
USA
Professionals
graduates
balancing
do not
demanding
merely earn a
careers,
doctorate,
family
they become the rare
responsibilities,
leaders
and
who
a
can
thirst for deeper
simultaneously
knowledge.
publish in the most rigorous
Unlike
journals,
traditional programs
secure
burdened by
8-figure
bureaucratic
grants,
hurdles
change laws,
and seasonal deadlines,
and still be welcome
our
for
process
coffee on the
is
block they
streamlined,
serve.
holistic,
This is
and
community health
human-centered,
scholarship
reflecting
at
the
its most
university's
powerful.
core belief that true
Year
scholarship
3 core
begins with
courses.
accessibility.
CH
Spanning just a few weeks
917
from submission
advanced
to
community
decision,
assessment.
it evaluates not only your
Community
academic
needs
readiness,
assessment methods,
but your lived expertise,
data-driven
your vision
community
for community
profiling,
impact, and your alignment
stakeholder
with our mission
engagement
of health
techniques.
equity through compassionate inquiry.
CH
Over
918
the past
advanced
decade,
health program
this
planning
approach has yielded a diverse
strategic
cohort,
planning frameworks,
60% from underrepresented
program
racial
design
and ethnic
and
groups,
implementation,
45% international
logic model
scholars,
development,
and 70% mid-career professionals who
923
bring frontline
advanced
wisdom
research
to enrich our
methodology.
virtual learning community.
Mixed methods research.
We begin with the foundational
Advanced
act of
experimental
formalizing your
designs,
interest, submitting the
research
online
ethics
application
and integrity.
This digital
CH
portal, accessible
919
advanced health
24/7
via our
informatics,
secure platform,
health
at
information systems,
www.buglobalextensionalytics
data
and visualization, serves as your entry point
digital
into
health
the TBUG
innovations,
USA family.
CH
And vision
920
logging in from your
advanced
home
grant
office
writing,
in Lagos, your clinic
funding
in Chicago,
opportunity
or a
identification,
cafe in Manila. The
proposal
interface is
development
intuitive,
strategies,
mobile responsive,
budget
and
planning
multilingual,
and justification,
guiding you through a series of reflective prompts rather than
rote
921
checkboxes.
advanced policy
The
advocacy.
form captures essential details,
Policy analysis
your professional
and
background,
development, current role in
advocacy
community
strategies
health,
and
be it
tactics,
direct service, policy
legislative
analysis,
process
or
navigation,
research coordination,
CH,
and a brief narrative on why
922
this doctorate
advanced health
resonates with your
education.
life's work. Curriculum
It's not a
development,
test of
endurance, but an
teaching
opportunity to
methodologies,
articulate your story. Learning
perhaps
assessment
recounting
techniques, how a childhood in a food-insecure
CH,
neighborhood ignited your passion for
923
nutritional
advanced
equity,
research,
or how years of pandemic
methodology,
response revealed the urgent
mixed
need for
methods
resilient health
research,
systems. Advanced
to ensure
experimental
technological
designs.
equity,
The platform
research ethics
auto-saves
and
your
integrity,
progress, offers voice-to-text for
CH,
accessibility,
970
and provides sample
dissertation,
responses from alumni to
independent
spark your
research
authenticity.
project.
Submission
Original
is
contribution
instantaneous
to knowledge,
triggering an immediate
capstone
email confirmation
experience of
with a
doctoral
personalized
program.
welcome video from
Year
the
3
program
core
director,
courses,
outlining your unique pathway forward.
USA,
Doctoral program
This step
in
is
community
more than
health.
administrative.
It's a
Year
ritual
3
of
is the
commitment,
crucible,
where
signaling
everything
to
our
previously
admissions
learned
committee
is
that
that
you are
forged
ready
into
to invest
independent
in a
scholarship
program that
and
invests in you.
transformative
Leadership. Thousands have
This
crossed
final
this
year
threshold,
shifts from
emerging
intensive
not
coursework
just as
to applied
applicants,
synthesis,
but as pioneers
professional
whose
mastery,
applications
and
foreshadow
the
the
production of
dissertations
original knowledge
that will one
that
day
will shape
grace the
community
shelves
health
of global
practice
health
for
decades.
decades.
Every
Next,
course is
providing
designed as a
academic
bridge to
transcripts
post-graduation
marks the
impact.
verification of your
Students
scholarly
leave
foundation,
not only with a doctorate,
a step we approach
but with
with
funded
grace
grants
and flexibility.
published papers,
At
active
TBUG
policy influence,
USA,
and
we
community
recognize that
partnerships that are
transcripts
already
are
generating
snapshots of
change.
past
achievements, not exhaustive
CH,
measures of potential,
917
especially for
community
professionals
assessment.
whose greatest learnings occur
Advanced
beyond
community
classroom
assessment
walls.
transforms students
We
from
require
consumers
official
of secondary
transcripts
data
from all
into
post-secondary
architects of
institutions
primary,
attended,
community-owned
uploaded
intelligence.
securely through our encrypted portal,
Community needs
or mailed
assessment
to our
methods
New
move
York
far
headquarters.
beyond standard surveys.
For international applicants,
Students master
we
rapid
partner with
ethnographic
credential
assessment
evaluation
procedures,
services like World Education
participatory
Services,
geographic information
WES, to
systems,
streamline
PGIS,
equivalency assessments,
where residents
ensuring
draw
that
their own
degrees
health
from
maps
Lagos
on
State
tablet
University,
devices,
or the
community
University
readiness
of the
models
Philippines
that score
are honoured with
stages of
change for specific issues.
But we go further,
and photo voice
applicants
protocols
are
that
invited
culminate
to
in
submit
public
supplemental
exhibitions
evidence
and
of
policy
experimental
demands.
learning.
Such
An
as
entire
certificates from
module is
WHO
devoted to
training
decolonized
modules,
assessment,
leadership roles
rejecting
in community
deficit
framing
coalitions,
and centering indigenous
or publications
and black
in local
ways
health
of knowing
journals.
health. This
Data-driven
holistic
community
review has allowed us
profiling
to
reaches
admit trailblazers
doctoral
like Dr.
Students
Aisha
integrate
Rahman,
census,
whose non-traditional
electronic health
transcript from a
records,
Nigerian
syndromic
nursing diploma
surveillance,
was augmented
social
by her
media
decade-leading
sentiment,
HIV peer
and
education,
crowdsourced symptom apps into
propelling her
dynamic,
to a dissertation
real-time
on
community health
faith-integrated stigma
dashboards built
reduction
in Tableau or Power
Transcripts
BI.
are reviewed within
They learn
72
small area
hours by our
estimation
dedicated
techniques
team,
when direct
with
data are
feedback
sparse
loops for any
and conduct
clarifications,
health equity impact
transforming
forecasts
what could
for
be a hurdle
proposed
into a
developments,
celebration of
new
your
highways,
multifaceted expertise.
gentrification projects.
In
Prison
this way,
expansions,
we build cohorts rich in
stakeholder
perspective,
engagement
where a
techniques
nurse
are
from rural
practiced,
Appalachia
not just
dialogues
studied.
with an epidemiologist
Students
from urban
facilitate
India,
virtual community
co-authoring
congresses
breakthroughs
using
in
global
mural
health
and
resilience.
Mentimeter. Create stakeholder
Central to your
power
interest
application
grids
is
the
the
submission
submission
of a
determined
research
governance, a
and
1,500
negotiate
data
trust
2,000
agreements
word
where
manifesto
communities
that
retain
unveils your
veto
intellectual
power over
heartbeat
publication.
and aligns it with the
The
program's
capstone
pillars
is
of
a full
advanced
community
research,
health assessment
leadership,
co-owned with a
and
partner
community
community.
engagement, complete with executive
This is not a
summary
dry
in plain
proposal,
language,
but a living
technical
document,
report,
a narrative
interactive
that weaves your
online
past
dashboard,
inquiries,
and a community
current
control
curiosities,
data repository,
and future visions
Many
into a
of these
tapestry of
assessments
potential
immediately
impact.
become the official foundation
We prompt you
for
to
local
address
health
key
improvement
questions.
plans.
What community health challenge
CH
keeps you awake at night?
918 Advanced
Perhaps
Health
the
Program
intersection
planning,
of
climate migration,
Here,
and maternal
students
health
learn
in
to
coastal
convert
villages.
assessment findings into
How
funded,
has your professional
scalable,
trajectory
equitable
prepared you
programs
to
that
interrogate
endure?
it through rigorous scholarship?
Strategic planning
And
frameworks
how might
begin with theory of
TBUG
change
USA's
workshops
workshops
that span
our
years,
CBPR
not months.
partnerships, global faculty
Students
network,
master VMOSA,
funded
vision,
dissertation
mission,
grants,
objectives,
amplify your pursuit,
strategies,
action
crafted
plans,
with guidance from our
results-based accountability
pre-application
webinars,
and collective
this
impact
statement becomes
then
the
critically
soul of your
interrogate
candidacy.
when these frameworks have
Faculty
harmed
reviewers
marginalized
seek not
communities
perfection
and
but
how to
passion.
adapt them.
The raw edge of a
Program
question design
unasked,
and
the fire
implementation
of an
occurs
inequity
through live,
unchallenged.
real-time planning
Alumni
with actual
like Dr.
community
Samuel
organizations, whose statement on
Students
refugee
use
mental health
intervention mapping
ecosystems
final steps
led
to
to a
produce
groundbreaking
detailed
mixed method
protocols,
study.
performance
Credit
objectives,
this exercise
determinants
with clarifying
matrices,
their dissertation
theory-based
focus years in
change
advance,
methods, and practical applications.
Submitted as a PDF upload.
Every program must explicitly demonstrate ensuring that your ideas, structural drivers not of your poor pedigree, health, shine, not merely behavioral ones.
This step fosters self-discovery.
Logic model development reaches advanced levels of their own doctoral create enhanced ready to contribute original knowledge that bridges academia and action and contingency branches.
Rounding out the core requirements,
they build through references
theories strong
selected
enough
not
to withstand hostile political
but as testaments to your character.
The signature assignment
and
is
collaborative
a complete,
spirit,
ready to
implement
program
community
plan
health
for a
leader
community
we seek to
partner,
cultivate,
including Gantt charts.
These should
fidelity
hail from
monitoring
diverse
tools,
spheres, adaptation
guidelines
supervisor
for cultural and
who can attest to
contextual
your
variation,
impact in health program
and a 10-year
implementation,
sustainability roadmap
an academic
that does not depend on
your
perpetual
research
grant
acumen,
funding,
and a community
CH
partner
919
who has witnessed your
advanced
engagement in
health informatics.
participatory initiatives.
In an increasingly digital
We provide
world,
a simple online
community
portal
health
for
leaders
referees
must command
where they respond to
information
tailored
systems
prompts
rather than be controlled
How does this
by them.
candidate navigate ethical
Health
dilemmas
information
in health
systems
equity
training
work?
includes mastery of
In what
FHIR
ways have they
standards,
fostered inclusive
open
teams
EHR,
amid resource
and
scarcity,
community-owned data cooperatives
share a story
that
of their
give
resilience
residents
in
control
crisis.
over their own records?
To honor referees' time,
Students
the
learn
process
to
is
audit
brief,
electronic health
15
record
minutes
systems
maximum,
for
and
algorithmic
confidential,
bias,
and
with
design
automated
race-aware
reminders
risk
and
scores
thank you
that
notes from
reduce,
our admissions
rather
team.
than reinforce,
This
disparities.
mosaic of voices paints a
Data
multidimensional
analytics
portrait.
and visualization
Dr. Elena
moves
Vasquez's
into predictive
predictive
and
highlighted
highlighted
her bilingual
analytics.
advocacy
Students
during a
build
board
machine
health
learning
crisis,
models that
tipping her
forecast community
application
health crises
towards swift acceptance,
opioid
and a
overdoses,
research assistantship,
heat-related deaths.
We
using
encourage
integrated
diversity
social
in
needs
references,
data,
then
valuing
overlay
intervention
insights from
triggers.
grassroots organizers.
They create
as highly
executive
as
dashboards for
community
ensuring that
health
your
workers
application
that
reflects the
display only
interconnected web
actionable
of relationships
in
that
culturally
defines
resonant
community
formats.
health praxis.
Digital health
Finally,
innovations form
embracing
the
the
cutting
freedom
edge.
of our rolling
Students
admissions
pilot
model,
chatbots
the
in multiple
application
languages
deadline,
that
none.
connect undocumented residents
This deliberate
to care.
choice underscores
Design TB
TBUG
exposure therapy
USA's
for community
commitment
trauma
to meeting you where you
and
are,
develop blockchain
free from the
verified
artificial
community health
scarcity
worker
of fixed
payment
dates
systems
that
that
plagues
eliminate
elite
exploitation.
programs. The final project
Applications
is
are
either
reviewed continuously,
A
with
working
decisions
health
issued
informatics
within 4 to
innovations
6 weeks,
deployed with a community
allowing
partner,
you to commence
or
in any of
B,
our quarterly
a
cohorts,
published system-level
January,
critique that
April,
leads to
July,
actual policy
or
change
October.
in data governance.
This flexibility has
CH
empowered countless
920
professionals.
advanced
A
grant
nurse
writing.
manager applying mid-shift
This course
during a
turns
flu
scholars
season
into
surge,
funded investigators.
or an international scholar syncing
Funding
with visa
opportunity
timelines.
identification begins with
No
sophisticated
waiting lists,
searching of
no
federal
penalties
needs
for later
CDC,
starts.
just an
HRSA,
open door to a
PCORI
program that
Foundation,
adapts to life's
and
rhythms.
state opportunities.
In a world
But
where
also
health
teaches
emergencies
students
don't
how to
pause
create
for funding
funding
when none
neither
exists,
does your path
legislator-directed
to doctoral
appropriations.
Community
With these
benefits
elements
dollars
in
from
harmony,
non-profit hospitals,
your application
and
becomes a
participatory
symphony of
grant-making where residents
transcripts
decide
as rhythm,
priorities, statement as melody,
proposal
references
development
as
strategies
harmony,
are taught
submitted
by
through our
faculty
portal to
who have
ignite a review
collectively
process
secured over
led by a committee
$200
of
million
faculty,
in funding,
alumni, and community
every section of a
stakeholders.
NIA 01
Expect
specific
holistic
aims
scoring
through
rubric
human
that
subjects,
weights lived experience
rigor,
at 40%,
and reproducibility,
academic
is dissected
potential
and
at
rewritten
30%,
in live workshops,
research vision at 20%,
students learn to write
and
for
alignment
multiple
with
equity
mechanisms
principles at
simultaneously.
10%. K awards
Interviews
are 0
when
3,
requested.
Our
Our
virtual
21
45-minute
PCORI
dialogues,
pragmatic trials,
not
and
interrogations,
foundation concept
opportunities
papers.
to explore your narrative
Budget
in
planning
depth.
and justification.
Acceptance
Receipts
letters
merciless
arrive
attention.
with tailored funding
Students
packages,
build modular
orientation
budgets,
schedules,
negotiate
and a
indirect
personal
rates,
welcome from
master
the cohort
effort
ahead.
reporting, and
Thus,
write
the
justifications
process is
that
not an
survive
endpoint,
the most skeptical
but a launch
reviewers.
pad,
propelling you
the
into
course
a doctoral
culminates in the
adventure
submission
where
of a
every
real
submission
grant.
sows
Most
seeds for
students
societal
submit an
flourishing.
actual application
As
during
you
the
gather your
term.
materials,
The
reflect on the
historic
broader
success rate
ecosystem
for this
awaiting
course
you.
exceeds
Virtual
65%
orientations that
funded
build
on
instant
first
bonds.
submission.
Pre-matriculation
CH
research seminars to refine
921
your
advanced
interests,
policy advocacy,
and a dedicated success
Students
coach to navigate
graduate
any
able to
curveballs.
move legislation,
TBUG
and hold power
USA's
accountable.
application is
Policy
engineered
analysis
for equity
and development
fee waivers
includes
for
advanced
first-generation
regulatory
scholars,
science,
translation
writing
support
comments
for
on
non-native
federal register
English
notices
speakers that actually
and text
change
stipends
rules
for low bandwidth
performing
regions.
regulatory impact analyses.
In submitting
and
you
drafting
join
a
a
lineage
lineage
of
of
using
500
real
plus
legislative
doctoral
council
alumni
templates
whose theses have influenced
advocacy strategies
WHO
and
guidelines,
tactics range from
sparked
insider
federal
negotiation
legislation
to
and
disruptive
birth
protest.
community health nonprofits.
Students master coalition
This is
tables,
the threshold to
media
legacy.
training,
Cross
writing
it with the
op-eds that
assurance
get published,
that we are as
television
invested in your
interviews,
arrival as you
TikTok
are.
testimony,
Contact
and direct
action
information
planning that centers affected
to
communities.
bridge any lingering questions.
They
and personalize
participate
your
in
journey
live
into the
legislative
sessions via
TBUG
Zoom,
USA
delivering
doctoral
testimony
program in
that has
community health.
influenced actual
Our
bills.
contact channels are open
Legislative process navigation
expertise
covers both
and
federal and
unwavering
state
support.
levels.
Students
At the
track
helm is the
bills in
program
real
director
time
of
using
the Health
forum
Science
and legislative department, build a role entrusted to Dr.
negotiate
Lara
amendments,
and celebrate miles per hour,
more final votes.
A trailblazing epidemiologist
The capstone
with over
is leading
25
a
years
successful
bridging
policy
academia,
change.
Many students
and
see their
grassroots activism.
advocated provisions signed
Dr.
into law
Thompson,
before graduation,
whose dissertation illuminated
faith-based responses to hitherto
sub-Saharan
advanced health
Africa,
education,
now stewards our program
graduates will
with a
teach
vision
the
of
next
health
generation
as sacred stewardship.
so they must master transformative
Her leadership
pedagogy.
has expanded our global partnerships,
Curriculum development moves
securing
beyond
endowments
learning
for
objectives
dissertation
to
fieldwork,
liberation-focused design,
and forging alliances
students
with
create
entities
syllabi
like the
that center
Pan-American
community
Health
voices,
Organization.
replace traditional
Reaching
textbooks
Dr. Thompson
with community
is
authored materials,
ensuring that your
and design
inquiries,
courses that
be they
award
on
credit for
curriculum
lived
customization,
experience, funding eligibility,
teaching methodologies
or
span the
dissertation
spectrum,
scoping,
flipped
receive
classrooms
prompts
using
insightful
community-generated
replies,
videos,
problem-based
email
learning rooted in local health
direct your
crises,
messages to
popular
info@global
education circles,
extensionusa.com,
and virtual
the
reality
central nexus
simulations
for
of
all
structural
program
incompetence.
communications.
Students
This
facilitate
inbox,
actual
monitored
classes.
daily by a
Some
responsive
teach
team
sections
of 3
of
admissions
TBUG
specialists,
USA's
guarantees
master's program
replies within
under
24
mentorship.
business hours.
Learning assessment techniques
vision
reject
crafting
multiple
and email
choice
outlining
hegemony.
your background
Students
in urban
design
health
performance
disparities.
assessments
Within a day,
community
you'll
impact
receive a threaded
portfolios
response from Dr.
and
Thompson
reflective
herself,
praxis journals
perhaps
graded through
including a
critical friendship
customized reading
protocols.
list or an invitation
The final
to a
product
live
is a
Q&A
complete
session.
course or training
This channel
institute
thrives on depth
that is immediately
Alumni
launched with a
recount how
community
initial
or
queries
university
evolved into
partner.
mentorships, co-authored
CH
papers,
923
and even collaborative
advanced
grant
research
pursuits.
methodology.
Whether
This
clarifying
capstone
transcript
methodology
evaluations
course integrates
or exploring
everything for
elective
dissertation
synergies with your
excellence.
career pivot to global health
Mixed methods
consulting,
research
this
reaches
email
full
is your
maturity.
portal to tailored guidance.
Students design and
Archived
defend
for easy
convergent,
reference in our
explanatory
secure
sequential
applicant
portal.
Exploratory sequential
Complementing digital
and
outreach
multi-phase
is our
designs
dedicated
that genuinely
phone line,
privilege community
+1
epistemology.
646
They
409
master joint displays,
4299,
meta-inferences,
and New
and
York-based
publication
number
strategies
operational
from
from 9
9
a.m.
a.m.
to
to 6 p.m. Eastern
Advanced
Time.
experimental
Monday through
designs
Friday
include
with
community
extended
partner
hours
cluster
during peak
randomization
application
seasons.
Stepped wedge implementation
This line
trials
connects you directly
smart,
to Dr.
sequential
Thompson
multiple
or her
assignment
associate
randomized
directors,
trials,
offering
for
the
adaptive
immediacy of voice
interventions
for nuanced
and
discussions,
micro-randomized
perfect
trials
for
for
dissecting
just-in-time
research
behavioral
fit,
interventions
or
delivered
troubleshooting
via
smartphone.
submissions.
Research
Calls
ethics
are
and
capped at
integrity
30
go
minutes to
beyond
honor
human
schedules,
subjects
yet
protection
they often
to
extend
research
into rich
justice.
dialogues.
Students create
A recent
community
applicant
IRB
from Kenya
equivalents,
resolved visa
negotiate
integration data
queries in
repatriation
one call,
schedules, emerging with
and
a clear
right to solution
timeline
clauses
and
for when
scholarship
partnerships
partnerships must end honorably.
Voicemail ensures no
The
query
course
is lost,
culminates in the
with
successful
callbacks
defense of the
prioritized by
dissertation
urgency.
proposal, including
For
full
international
methodological
callers,
justification.
we provide
power
toll-free
calculations
access
via
community
our app
benefit
and
agreement,
reimburse long
and
distance
dissemination
fees for
plan.
low-resource applicants,
CH
embodying our ethos of
970
barrier-free
dissertation.
access. The
Anchoring
pinnacle
these
of personal
TBUG
touchpoints
USA
is our
doctoral
comprehensive
journey
online
is an
presence
independent
at
research project
www.global
that makes an original contribution to knowledge
and to
a
community
dynamic
life
hub
that extends beyond
From day
static
one of year
pages
3,
into an interactive
students work
ecosystem.
under a committee of 3
Here,
faculty plus
prospective
at
students
least one
navigate
community
self-guided
co-mentor
tours
with
of the
decision-making
virtual campus.
authority.
Preview sample
The
modules
dissertation
from
may
CH
take traditional or
901
manuscript
advanced
format,
epidemiology,
but every project must
and
meet
access
4
a searchable
non-negotiable
FAQ
criteria.
repository covering everything
1.
from tech requirements
Original
to alumni
contribution that
outcomes.
extends theory, methods,
The site
or
features
practice
live
in
chat
community
with
health.
admissions ambassadors.
2.
Current
Direct,
students sharing
measurable
unfiltered
benefit to a partner
insights.
community,
And a webinar
not merely
archive
replaying
replaying
sessions
sessions
like
from application
3.
to defense.
Publication trajectory.
A day in the
At
life
minimum,
of a TBUG
one first
scholar.
author paper accepted
For
or
deeper
in press.
immersion, log in as a
4.
guest to explore the
Sustainability
applicant
plan
dashboard
that continues
where you
after
can upload
defense.
drafts for preliminary feedback
Students defend
or simulate
proposals
the
early in
research
year
statement
3.
rubric.
Receive continuous
This
peer
triad
and faculty
email,
review
phone,
through weekly
website,
online writing
forms
labs,
a robust safety
and
net.
present final
But our
defenses
support
in public
extends further.
virtual sessions
Monthly
attended
virtual
by community
coffee hours
partners,
with Dr. Thompson,
policymakers,
where small groups
and international
program
colleagues.
nuances over shared screens.
Many dissertations result
a
in new
dedicated Slack
community
channel for
institutions,
pre-applicants to connect
resident-owned
with peers,
data trusts,
and
ongoing
personalized video
intervention
responses
programs
for complex queries
or policy centers.
Dr. Thompson's approach
defense
is relational,
is not an endpoint,
not
but a
transactional.
launch.
Her
Graduates
door,
virtual
walk away
or
with their
metaphorical
degree is ever
a funded
ajar,
continuation
reflecting
plan,
the program's
and an
belief that
established
true
education
education
begins
as
with
scholars
connection.
who keep their promises to communities.
Contact us not as supplicants,
By
but as
completing
collaborators.
these year 3 core
Your voice
courses in the
shapes the
dissertation
program
as much as it
TBUG
seeks
USA
entry.
graduates do not
In
merely
reaching
earn a
out,
doctorate.
you tap into
They
a legacy
become
of
rare
responsiveness
leaders who can
During the
simultaneously publish
2024
in the most
enrollment
rigorous
surge,
journals.
Our team
Secure
fielded
8-figure grants,
1,200
change laws,
inquiries,
and still
converting
be welcome for coffee on
85%
the block
into
they serve.
matriculants through empathetic,
This is
efficient
community
health
engagement.
scholarship at its most
Whether a
powerful.
quick clarification on
Year
reference
3 core
formats
courses or a profound exploration
CH
of how biblical
970
principles
advanced
inform
community
health policy
assessment.
Advocacy. These channels are
Community needs
bridges to
assessment
belonging.
methods. As Dr. Thompson often
community
says,
profiling.
your question is the first thread in the fabric of our shared
needs.
scholarship. We await your message,
918
your call,
Advanced Health
your visit
Program
to the site.
Planning.
Eager to weave you
Strategic
into the rich
planning
tapestry of
frameworks.
TBUGE USA's
Program
community
design
health and
doctoral
implementation. With these
Logic
next
model
steps
development.
illuminated, envision the horizon. Your application submitted,
Advanced Research
transcripts
Methodology,
affirmed, research statement
Mixed
ablaze
Methods
with purpose,
Research,
references resounding with
Advanced
endorsement,
Experimental Designs,
and no deadline to dim your momentum.
Research Ethics and
The
Integrity.
program director's team stands ready.
Email
919
pinging,
Advanced
phone
Health
ringing,
Informatics,
website
welcoming to guide
Health
you across
information
this
threshold.
systems. This
Data
is not the end of
analytics
our
and
narrative,
visualization,
but its exhilarating continuation.
Digital health innovations.
Your chapter in a story of health transformed,
920
communities
Advanced
uplifted,
Grant Writing.
and legacies etched in equity.
Funding
opportunity
Step
identification.
forward.
The program
Proposal
and the world it
development
serves
strategies.
needs your light. Budget